yet.
You
can hope, Ty. You can hope.
Only you, Ty. Only you.
Is that what town gets some viewership revenue?
And you don't know this, but we were on some call and there were people in the chat room saying, "Is Ty single?"
Watch out.
I know, when you got it, you got it. I know. I know.
I remember that. Yes, I remember that. Yes. Was that the some Democratic function or something?
I don't remember.
I remember that. Yeah. It was a while back.
Ty did get that haircut that we were talking about last week.
Yeah.
My housemate shaved my head. Yeah.
It looks better. My daughter-in-law does my son, and he looks like an Auschwitz inmate. It's just terrible.
Yeah, it's really bad. At-home haircuts are hard.
Hey, watch out. I've been doing them for 30-something years.
Yeah, for people who have talent, that's one thing, but like nobody.
I made a nice income in college cutting hair. And I couldn't, my typing was so-so, but my haircutting was pretty good.
Nobody should let me near a pair of hair cutting scissors ever.
Okay, you can do that. I have all the gear.
Hello.
Hello. Hey, Jess.
We're missing Karen. We're missing Hangbin. Who else?
Jess, your face is in a deep shadow tonight. Is that on purpose or?
No, but I'm sure it's fine for everyone involved.
You look like the mystery witness on 60 Minutes.
Let's see.
Whoa.
Now we look like the wizard.
Now the interrogation begins.
You're good. You can do however you like.
So we're missing Hangbin and Karen?
Yes.
2.5 minutes.
Okay, in about 2.5 minutes on our cable cast being ready.
Right, getting everybody in.
Flo Millie. Hi, Flo.
There's Hangbin. Amy, so it looks like the only thing we have folks signed up to speak about is the non-discrimination ordinance. Is that correct? Yeah, thank you.
Yes.
Twenty seconds.
I'm back. Sorry, my internet is unstable.
And we're about 15 or so seconds out.
5 seconds.
Okay.
Or 5.
Okay, we're good.
And you're live.
Good evening, everyone, and welcome to the January 13th Town of Chapel Hill Council meeting. We're glad to have those of you who are here with us virtually or watching us online, or those watching later. We are meeting virtually for a while longer, as everyone else is doing the same during this time of COVID. We have 5 items on our agenda tonight for discussion, including an update from Orange County on the COVID vaccination implementation plan, an update from UNC on the spring semester planning, consideration of amendments to the town code to include a non-discrimination ordinance, an update from Awasa on a long-range water supply, and a concept plan for redevelopment of 150 East Rosemary Street. For anyone wanting to speak this evening, we ask that you use the raise.
Okay, it looks like our mayor is having some technical issues. So I think what she was saying is that if you want to speak, use the raise hand function in the participants, or you can use, I think it's *9 on your phone if you're joined in by phone. I wasn't planning on doing this, but we'll make it work. I believe the next item is a roll call. I'm sure Pam may have some announcements she'll make when she joins us, but in the meantime, I guess we can do the roll call, or should I wait until Pam comes back so she can be part of the roll? And
It's not necessary for a quorum,
Okay.
and she can do it when she's on. I'm sure she's on, but
Okay.
So it's fine to do it. It's fine to roll call her in later.
okay, then let me go through the list. Councilmember Anderson,
Here.
Councilmember Boincy,
Here.
Councilmember Gu,
Here.
Councilmember Nguyen,
Here.
Councilmember Ryan,
Here.
Councilmember Stegman,
Here.
and Mayor Pro Tem Parker is also here, and we await the rejoining by our mayor. Next, according to my agenda, is public comment for items not on the printed agenda. I do not believe we have anybody signed up to speak tonight in that regard. Amy, am I correct in that?
Nobody pre-identified.
Okay, and I don't see any raised hands anywhere, so I think we're good. Okay, then.
I'm back. Where have you gotten? Sorry.
Oh, okay. I just went through the roll call.
Great, thank you. I'm going to try to make these announcements really quickly, and then Alan will move to you for the proclamation, if that's okay. If my internet goes down again, I'm sorry, they're working on this side of town right now. Our community will be celebrating the life and legacy of Dr. Martin Luther King Jr. on Sunday evening and during the day on Monday. Sunday evening at 6 p.m., the University Community Martin Luther King Jr. Memorial Banquet will be held virtually. This year's speaker will be North Carolina Superior Court Judge Carl Fox. And to register, you need to visit the UNC Office of Diversity Inclusion's website to do that. So that's great. And on Monday, the NAACP will be hosting Speaker Reverend William Barber. The free virtual celebration will be at 11, and you need to register online to be able to attend. So we encourage people to do that. People's Academy is back up virtually this spring in March, and we'll be holding a 4-week virtual People's Academy. It's a way to learn about the town services and to connect with town leaders and other members of the community. It's also a great way to learn how to get involved with town government. The programs will take place on Saturday mornings in March. Interpretation will be provided if needed. And I know that it's going to be done virtually, so I'm not sure childcare will be provided, but information is available on the town website, and applications are being accepted through February 19th. So we have those, and tonight we also have a proclamation. Sorry, before we get started, and I will turn it over to Mr. Boincy to tell us more.
Good evening, everyone. I'm here to just summarize a proclamation that the town is issuing in recognition of National Mentoring Month this month, January. And mentoring programs such as Big Brothers, Big Sisters of the Triangle, Mentor North Carolina, the 100 Black Men of Triangle East, and the Blue Ribbon Mentor Advocate Program really make our communities and our state stronger by creating impactful relationships that increase social capital for young people. And they also provide invaluable support networks. And especially during this COVID-19 pandemic, mentoring programs have really stepped up to fill in some gaps for young people and families. It's been connecting young people with resources, ensuring that those mentoring relationships continue virtually, and to ensure that physical distancing doesn't mean social disconnection. As most of you all of you all probably know, mentoring plays a pivotal role when it comes to career exploration, and really helps to support workplace skills by helping young people set career goals. And then, of course, in any good quality mentoring program promotes healthy relationships and communication, positive self-esteem, emotional well-being, and the real growth of a young person. And I'll just say briefly about my own experience with mentoring. Of course, as I grew up in Chapel Hill, I had great mentors and coaches and in teachers. But one of the more impactful mentoring relationships I had was actually after I got out of college, and I was coaching at my alma mater, East Chapel Hill High School. Got to know, meet, and develop relationships with a lot of good young people. But one person that stands out in particular, I remember I had coached him from his sophomore year up through his senior year, and had gotten to know him, his family, and his family, really welcomed me, embraced me as one of their own. And particularly when it came to college, he really hadn't thought much about going to college. And so I was able to connect him to some folks, connect him to campus tours, so he could actually see what college was all about. He ended up applying, getting in, and really since then, since college, he's had a great career, and I believe he just made it through basic training in the military, and so he's going to be serving his country in one of the greatest ways imaginable. So I'm very proud of him, and very proud that I was able to have some kind of role in his development and into the great young man that he is. So I encourage everyone out there to recognize the month, and if you know young people who could use some guidance, don't hesitate to reach out, and also don't hesitate to plug them into some of our fine existing mentoring programs. Thank you.
Thank you, Alan. Thank you for being a mentor. Thanks for helping encourage others to be mentors in our community. It is a wonderful experience. And thank you to all of you out there who already are mentors. So that's wonderful. Thank you for sharing. Any other announcements from council members? Ms. Good.
Next Wednesday, January the 20th, is the inauguration day, and there are some community members that we have expressed the wish that we are going to celebrate in the group. If there are others that would like to join us, we are planning to have this caravan that leaving at 10 a.m. around the university place and going through the Chapel Hill and the Coral downtown and near the Weaver Street Market area. So if you would like to join us, it is a community originated celebration. We just reconfirm in our faith, in our democracy, and as one people coming together. So if you want to join us, it is very relaxed, joyful caravan going through the Chapel Hill and Coral downtown. So you're welcome to join us at Wednesday, the 10 o'clock in the morning.
Okay, thank you. Oh, there's a lot going on as always. All right. We didn't have anyone sign up ahead of time to speak on items not on the printed agenda for this evening, but if there's someone out there wishing to speak on something not on the printed agenda, could they use the raise the hand function or the *9 function? And council members, while we wait to see if anyone's doing that, we have a revised consent agenda before you. We needed to add in the legislative breakfast that we're holding with our legislators coming up on January 25th. And we needed to make sure that we recognize that the Assembly of Governments is being canceled or postponed this year due to being the technical difficulties of having that many people meet together on Zoom and have a functional meeting. So those are, and there's a few other minor changes on there, but it's a revised consent whenever Someone's ready.
move revised consent agenda.
Second.
It's been moved by Ms. Anderson, second by Mr. Nguyen, the revised consent agenda. I'll need a roll call vote, please. Mr. Parker?
Aye.
Ms. Anderson?
Aye.
Mr. Boyncey?
Aye.
Ms. Gu? I didn't hear you. Yeah.
Aye.
Okay. Mr. Nguyen?
Aye.
Ms. Ryan?
Aye.
Ms. Stegman? And the mayor says aye as well. So that's unanimous. Thank you very much. Okay. You have information in your packet as well. And kudos to a smaller packet this time. Yay, thank you, staff. But first up will be our wonderful Orange County Health Director is here to share with us about the Orange County Health Department COVID-19 vaccination planning and implementation plan. So thank you for joining us. Quintana, we're thrilled to have you here. I get the pleasure of seeing you pretty often. But thank you for coming to help educate our community about what's going on in Orange County.
My pleasure. Good evening, Mayor Hemingway and the rest of the council. Thank you for having me. And so I have a brief PowerPoint presentation. I don't know if that made it or not. If not, I can just speak and talk to you from my slides. But basically, I was going to start off our time together this evening, just giving a brief update on some of the metrics, talk about our current county orders that we have in place, expand a little bit on our vaccination plan and talk about our distribution efforts to date. And then I cannot leave the session without talking about the priority areas, because I know that made lots of media outlets on yesterday. So just to start out, I guess briefly talking about the metrics, our case count as of today for Orange County, we have a total of 5,839 lab confirmed COVID cases. This is 47 new cases from our case count yesterday. And I believe, yeah, thank you. So that's what's in the slides, because I put the slides together on yesterday. And so I did not yet have the data for today. So over the past 7 days, we've had a total of 480 new cases. So right now we're averaging about 69 new cases per day. Unfortunately, we've had a total of 68 deaths in the county related to COVID-19 as well. Yeah, next slide. And so when we look at our 4 metrics over a 4-week trend, you can see we have red lines in each of the 4 quadrants. So our numbers are not going in the right direction. So our confirmed case count continues to increase, and clearly we are seeing this as a result of gatherings and some travel that happened over the holidays. The hospital continues to be, busy with ED visits for COVID-like illnesses, and the number of hospitalizations for COVID patients that continues to rise as well. And then our percent positive. And this is one that we've been monitoring. We monitor, from the beginning, but we look at what our percent positive is for all the tests conducted in the county. So the goal is to be 5% or less. And I have to say, we have exceeded that. And so based on the testing data up through January 10th, we're sitting at 10.1%. And it fluctuates if you follow it on the North Carolina DHHS site. As of today, looking at our tests, we were at 7%. But either way, we are above the 5%. So we're not going in the right direction there. So numbers aren't great, and we got some work to do if we want to turn it around. Next slide. So I think there's been some question. I've got some questions from community members wondering if we were going to implement any more restrictive orders and rules in the county at this time. As Mayor Hemminger mentioned, I am in communication with the board chair and all the mayors on a regular basis. And so our local state of emergency declaration was amended December 16th. Chair Price, she amended that order. But at that time, the mayors and the chair decided we were going to stay the course and we were going to stay in alignment with the governor's executive order. So last week, the governor extended Executive Order 188, which is the modified stay-at-home order, and that's going to be good at least through January 29th. So in that order, you may recall, everyone is required to stay at home between the hours of 10 p.m. and 5 a.m. Businesses and activities must cease or close their operations between 10 p.m. and 5 a.m. And then alcohol sales are prohibited between 9 p.m. and 7 a.m. Last week, Secretary Cohen also issued a Secretarial Directive. And her directive, it orders all North Carolinians to do the following things. So only leave home for essential activities. So that includes going to work, school, healthcare reasons, to care for a family member, or to buy food. She's encouraging all residents over 65 or at high risk for developing serious illness to stay at home, avoid leaving home. She went a step further to say maybe you should use a delivery service or alternate pickup methods for food and retail items. Avoid gathering with people who do not live with you. Wear a mask and keep distance from people when you leave home. Avoid any indoor spaces where people are not wearing masks, and then stay away from crowds. Avoid places where people may gather in large numbers. Next slide. And so now to talk about the topic I think that we're all really interested in and following at this time, our vaccine distribution plan. So right now, to date, our vaccine providers, we are required whenever we sign to say we would provide the vaccine, we were required to sign an agreement with the state that we would follow those priority areas as outlined in the North Carolina COVID-19 vaccination plan. And the guiding principles for that plan, you may have seen this, but number one, the list is to have equitable access to the vaccines. The vaccine planning and distribution is inclusive, actively engages state and local government, public and private partners, and it draws upon the experience and expertise of leaders from our historically marginalized communities. We are to be transparent, accurate, and provide frequent public communication so that we can build trust. The data is used to promote equity, track our progress, and guide decision-making. We are to be appropriate stewards of the resources and continue our evaluation and improvement to drive successful implementation. And then one that I know we at Orange County Health Department and the UNC Health System, no dose is wasted. And you maybe you saw a media story right after the new year where there was some speculation that Health Department just gave away doses, but that was not the case. In fact, we inadvertently began thawing some doses, some vials that we knew we couldn't use in a timely manner. So we called our partners at UNC, and the whole goal was not to waste a dose, and we were successful. So no dose was wasted, and the vaccine went to those in the appropriate priority group. Next slide. So a big part of our distribution plan, it requires the help of our vaccine providers. And so right now, currently, the state is enrolling providers. So for those that have completed our enrollment, that includes the hospitals, local health departments, the federal pharmacies, that's the CVS and Walgreens, they got the contract and they are taking care of the long-term care facilities. Currently enrolling the federally qualified health centers, rural health centers, the free and charitable clinics. And so I know for us locally, Piedmont Health Services, they have been approved, their enrollment is complete. I'm not certain that they've received their first vaccine allocation, but they are an enrolled provider at this point. So the next group that the state will start to enroll is corrections health, occupational health, providers serving congregate living facilities. And so their provider enrollment plan actually follows the priority groups as outlined in the vaccination plan. Next slide. And I don't expect you to be able to read this and see it, but it is on our website, and I included the link at the top of the slide in case you want to go there to see the priority groups as listed. We can go to the next slide. And so yesterday, the federal government made several announcements about their recommendations to now include 2 additional groups in phase 1B. So there's been conversation or recommendation that persons aged 65 to 74 years of age and persons 16 to 64 years of age with a high-risk medical condition now be added into phase 1B. So as of a call yesterday at 1 o'clock with the state has not made any changes to the vaccine priority groups. They were awaiting some written guidance from the federal government, and upon receipt of that guidance, then they'll communicate down to the counties any of those changes. I don't know what the final decision is, but we did get an email at around 6 this evening and we're all scheduled to jump on a call, tomorrow morning at 9 to hear what, if any, changes are going to be made to the priority groups. Next slide. So who is being vaccinated now? So currently, we are continuing to vaccinate those from phase 1A. So that's the healthcare workers, those at high risk, those attending to COVID-19 positive patients, and then our long-term care facility staff and residents. For the most part, I think we are almost complete with phase 1A here in Orange County. We have a few folks that are trickling in, but the bulk of those that fit this criteria have been vaccinated at this point. As of last week, Thursday, the health department, we opened up and we began the process of vaccinating those in phase 1B, group 1, and that is anyone 75 years of age and older. And I have to tell you, we have been busy. And so I don't know that our phone system and our staffing levels were prepared for the demand that we received, but each day we continue to tweak our process and we try to improve it. But I'm really happy and excited about this because I know I have some peers in other counties where they don't have demand and folks that are wanting the vaccine. So I'm really happy to see that the residents in Orange County are excited and they want to get the vaccine. But this is the group that we're currently vaccinating at this time. Next slide. That's the next slide. Oh, okay. And so this is a screenshot. I also included the link at the top of the slide. If you want to follow and keep up with vaccine distribution throughout the state. And it's similar to the case count map where you can hover over a particular county and it will give you information about how many doses have been given in your respective counties. So here in Orange County, and this is actually already outdated. They only update the site every Tuesday. But you can see here on the map that as of Tuesday, we had 6,168 folks in Orange County that had received the first dose. And then we had a little over 1,100 who had received their second dose and completed the series. I will tell you, for Orange County Health Department to date, we've completed 1,331 vaccinations, and those are all first doses. So the rest of the numbers that we have, they're coming from UNC Health, because right now that's the only other provider in the county. But again, this number is really off because if you go to the UNC site, they've actually vaccinated over 23,800 folks with vaccine at this time. So kudos to UNC Health System, great partner, and they have really perfected this vaccination process. So much so, maybe some of you all heard in the press conference yesterday from the governor, UNC Health has been named one of the 10 mass vaccination sites throughout the state. And so it looks as if the governor has identified 10 sites throughout the state where they have some high throughput clinics. And so they're looking to set up and really, I guess, supply a vaccine in a large quantity there because they have shown that their operations are pretty efficient and they're able to vaccinate a lot of people in a short amount of time. So again, I think this is a testament to UNC Health, strong partners. I'm very grateful and I feel honored and lucky to be able to work with them, but they have done a great job vaccinating folks in our community. Next slide. So the other thing that's been in the news lately, there is a new variant strain of COVID-19 circulating. It's been seen to come out of the United Kingdom and South Africa. To date, the variant strain appears to be more contagious, but it does not seem to make people more ill. The existing vaccines don't appear to be any less effective against the new mutations, but they may have to be tweaked in the future. So because of this, you can go to the next slide. It is imperative that we double down and we continue to practice the 3 W's. So even after someone is vaccinated, we will still require that everyone wear the mask, wait 6 feet, and wash your hands. Because again, there's still a lot about the vaccine that is unknown. I know I got the question earlier. Someone asked, does the vaccine reduce transmission? Well, the Pfizer and the Moderna studies looked at symptomatic infection. So, based on the studies, if you get the vaccine, then you're less likely to become ill and symptomatic from the virus. However, we do not know if the vaccine will prevent transmission. So you could still be asymptomatic and you may be able to spread it to others. That part we don't know because that wasn't included in the study. So we just have to wait for more data. And for this reason, it is going to be so important that we not give up and that we continue to practice our 3 W's, wear, wait, and wash. So are there any questions for me?
Thank you, Ms. Stewart. Mr. Boynton, Ms. Gu?
Hello, Ms. Stewart. First off, I want to thank you so much for all of your hard work and the leadership that you provided. These are some really tough times, and I know you've had to take some tough positions, but I firmly believe that we as a community are the better for them. So I thank you, first off.
Thank you.
I just had 2 questions. My first one is, I remember you had mentioned one of the guiding principles is to ensure equitable access to the vaccine.
Mm-hmm.
Can you tell us about some of the ways in which the Orange County Health Department is ensuring equitable access?
Sure, absolutely. So when we opened up this last priority group, 75 plus, an immediate barrier is that digital divide. And so to date, we were prepared because of group 1A and what we thought would be the next subsequent group. All of our registration processes were online, and that's not working for the 75 plus. So some of the things that we're doing, and as I said, each day, the team, we debrief and we figure out what can we tweak, what can we change. So we had County IT, they really ramped up and gave us a phone system that's still not perfect, but much better than what we would have started with. So we've now changed a lot about the registration process. So now a community member can call for this 75 plus group. They can call, give us their first name, last name, and birth date. That's the only criteria that we need. And we can look and just put them into a slot for an appointment. And then after that, we work with them on site to complete the lengthy, registration that's required for that COVID vaccine management system with the state CVMS. So that's one way we try to reduce that barrier. We know that we still have some historically marginalized communities that even to make a phone call and get an appointment is yet another barrier or a challenge. So this week, we pulled together our human services group. So this would include partners throughout the county, other county departments, DSS, housing, transportation, Department of Aging, and a host of community partners that we know work with this community, this population on a regular basis, whether it be through their transportation to medical appointments, or if they have some kind of guardian relationship with social services. So we're working with them because they can help us reach these individuals that may not see the announcements via the news or media outlets. And so we're tapping into that resource so that we can make connection and make sure they get their vaccine. And then the other thing that we're piloting, and we're not advertising it because, again, we're trying to reach a specific community who probably has not had the opportunity to drive down to Chapel Hill or Hillsborough to one of the 5 sites. But we're working with some local churches and community partners to set up a closed point of dispensing site for that community. So we're leaning on those community leaders to go out and grab those that need the vaccinations, make the list for us, and we'll do all of their registration on site as well. So still not a perfect system, but like I said, we're learning from our partners what we need each day. So trying to address that digital divide, trying to remove the barriers of transportation to get them there, and just reaching out as best we can. And we are open because this is a new group that just started this week, but we're open to input and feedback from the community. So if you know of pockets that, hey, you're forgetting about this group, we want to hear about it.
Wonderful, wonderful. Thank you. And then my second question is how can we as a council, as a town, be supportive of your efforts and the efforts of the health department?
Oh, well, thank you. And I would have to say, I think that the town in general has been very supportive. We work a lot with Kelly Drayton and Chief Harris and Chief Blue, and everyone has been extremely supportive with, lending us staff to work the pods and other resources. So I would say if you could just continue doing what you're doing when we call and have a need and, need some assistance, you all could just continue what you've been doing throughout the entire pandemic. That didn't just start with the vaccination process, but the town has been a wonderful partner and I really appreciate it.
Thank you.
Okay, thank you. Ms. Gu, then Ms. Anderson.
Yeah, again, I would thank you very much to our health department and to you in your stewardship in really managing this pandemic in our Orange County. I think it is, the number, of course, we are facing the similar challenges as the rest of the country, but the number overall, I think the Orange County, in comparison with the rest of North Carolina and the other parts of the country, I think we're doing an astounding job in protecting our residents, protecting our businesses. I think we owe a lot of thanks to you and to our health department. And I think, of course, we have a lot of regional medical resources. I think that we're very fortunate for that as well.
Yeah, thank you.
Yeah, I think I have heard many people to talk about that. And we just feel like, especially in time like this, we see that what our effective government can actually do and can deliver to our community. So I'm really appreciative for the work that we're doing. So for the next phase, especially when the vaccine is related, a lot of people are, I think, like you said, we're fortunate with a community that's well educated and informed. They're open to have this vaccine, actually looking forward to that. So can you explain, from a resident's perspective, what they can do, let's say if they're interested, or let's say if they fit into certain categories that's over 75 years old or over 65, or have certain risk category, what they can do? How do they do the registration, or how do they get themselves in line, or should they drive into a clinic? Can you explain that from user perspective, what they can do or what they can expect?
Yep. So right now we're asking folks that if they're not in the phase 1B group 1, the 75 plus, we're asking if they'll just wait and give us a little time, because the systems are really overwhelmed in trying to get the 75 plus registered and in those appointment slots. But as the next group comes on board, then we've added this, it's the top of the header of the county webpage, our communication team, which is also made up of several of the communicators from the Chapel Hill town and all throughout the county. But we are all pushing out lots of messages, radio, the TV, internet. So we try to announce when the next group is coming up. And then the process usually will start with going to our website and clicking to register to get an appointment slot. We opted not to do the first come, first serve. I know a lot of my peers in the surrounding counties, they are doing that. But we absolutely do not want to have community members show up and wait in line for hours, and there's no guarantee that they'll get a shot. So we opted to stick with the appointment mechanism for this pod setup. And I have to say that I don't want folks to think that the health department is the only place where you can get your vaccination, because UNC Health also is operating and they're open to the public as well. So they also offer vaccination to the community members, not just their patients. And so on their link as well, you can go there and they have a similar process where you register online to get an appointment for your shot.
Yeah, but it seems like what I heard from people is those registration links, they are I think on Monday, some early Monday, it says that it's full already.
Yeah. And so that's part of where we're trying to tweak and change some things up, because it's getting full really quick. Yeah. The other thing I would say from the health department's perspective, we're working still with limited vaccine. So at the beginning of this week, I had more appointments slotted, based on my thought and hope of what my allocation would be coming in at the beginning of the week. And so we tamper and play with those schedules based on our allocation. Right now, we don't know from week to week exactly how much we're going to get. We're trying to get an idea. We can kind of guesstimate, but so that has also been a challenge here in the early phases, not knowing exactly how much vaccine you're going to get. Then you don't know how many appointments to build out. So it's tough right now. I just ask that everybody be patient with us. But again, we are learning daily and making tweaks to this process, trying to make it simple and smooth.
Yeah, well, thank you so much. I totally understand. I mean, this is something can be completely new, and this vaccine, because of the challenges that with its sensitivity to temperature and all the things that are contributed to this, the complexity of carrying out this huge endeavor. But I do really appreciate all the work that you have been doing. So another thing is I heard is from the immigrant community, well, especially the seniors, they may not have a language capability at all to understand what is going on or how they get in, but they're concerned, they're worried. So what kind of efforts do we have to reach out those people who may not really have the language capability to fully understand what is going on? What kind of efforts do we have in there?
Yes, ma'am. And so we still are working with those community partners. We've always had a pretty active and robust immigrant community partnership group that, you know, we work with and work with some of those trusted leaders. But anytime they call into the health department, we also use our language access interpreters. And so if they don't speak English, that's not a problem. We'll get an interpreter on the line that can translate and communicate the information needed to make their appointment. And the same thing when they come out on site to actually get the vaccination. We use the iPads and we do the virtual interpretation for those appointments as well.
Yeah, well, I'm wondering if it's possible. I understand there's so many other things that on your plate, but I remember that at early stages of the pandemic, our town used to release those important announcements, like about 3 Ws and those things in multiple different languages. If we can do that with regard to like registration links in different languages, I will reach out to the communities and send out to them. I think that probably is very helpful.
Yeah. And I think once we solidify and we get this registration process really nailed down, I know we absolutely intend to do translation in all 6 of the languages that we traditionally do our translations in. So yes, thank you. And I'm sure Kristen Prelup, she's our public information officer at Public Health. And I know that is a priority for her. And she was like, when can we translate? We got to translate. So we are working on it and we want to.
If you need any help, I would be more than glad to do anything I can to help out.
Okay. Thank you. I'll be sure and let her know that. Thank you, Ms. Good.
All right. Ms. Anderson?
I'll just echo the thanks, Ms. Stewart. You're one of the people I think about when I think about people who maybe didn't know what they were signing up for this year, but you've really been completely inspirational and amazing in keeping our community safe. So thank you for that. I have a couple questions that I've been asked that I had no idea how to answer. One was like, I may get this wrong, but apparently there's some sort of standby option for at Duke Health that employees, if they're not in the priority list, if there's just leftover vaccine at the end of the day, like you said, we don't want to waste any. Are there, I was thinking more of people who are like, you know, near the cutoff of 75, but maybe aren't in that first list. Is there some sort of standby that people can do if they really want to wait around and hope?
Right. So up to date, we have not had an issue with that, again, because we're using the appointment system. So we try really hard to stick to where we know we'll get this many out of this file, and we try to do the appointments accordingly. And so what has happened to date, and being totally honest, if we get to a situation where there's 1 dose extra and it's left, we are absolutely doing that. And we tend to start with those that are working the pod vaccination sites because there's always a slew of volunteers that come through and help us. And so again, we try our best to stick to those in that priority group. But if we get to the end of a pod session and there is 1 or 2 doses, again, priority, we are not to waste. And this is instruction from the state. They say, find a live person, find an arm, but do not waste. This is like liquid gold. So we are not wasting, but we don't have a formal list of folks that we call and say, we have this extra dose. We just haven't run into this situation yet because we've done pretty good with planning out those appointments. But this could be incentive for folks if they want to volunteer. You know, if you're on site and you're working a pod site, then there's a good chance that maybe you could be up for
that was actually one of my questions. So maybe
Yeah.
that can be incentive in terms of volunteers. Do you need more volunteers? I know there's kind of a medical professional type volunteer and then maybe not so much. But
Yes.
do you still need people to sign up? And if so, will you tell us where to go and how to sign up?
Yes. And so if you want, you can route list or names to me to start with, but I do have a couple of staff in the department that are coordinating our volunteers. And you're right, we need both medical and non-medical. For the medical, of course, we have to do some certification to make sure their license are good and, you know, that they are working within their scope. But we have lots of tasks and jobs that the non-medical folks can help us with as well. So yes, please send us any and everyone that wants to volunteer.
Okay, I'm sure we can do that. And then my last question is kind of, this is more, again, something somebody asked me and I didn't really know what to say, but when we talk about folks who are getting that are getting vaccinated, who are, you know, 75, 76, 82, whatever. And then if they are living with a spouse or a caregiver or a friend or anybody who is under that age or is not in that priority group, what does that mean in terms of, you know, since there's still this kind of question about whether you can be a asymptomatic carrier or all these, you know, how does that look in terms of, you know, not vaccinating two people in the same household? I mean, is that an issue or is it just we have to deal with it or is it okay?
So it is pretty common right now.
Yeah.
In fact, I dealt with a call from my father earlier who had the same question from one of his buddies whose wife is a nurse. And he's like really upset. Well, she got vaccinated if they won't vaccinate me because he hadn't met the criteria yet. There's no perfect solution to any of this, but we're following those priority areas, you know, that the federal government and the state put out based on who seems to be impacted the most. And so that's a guiding principle that we get the vaccine to those at highest risk. And that's how the 75 plus, they moved up because originally they were not in the 1B group. But as they continue looking at the data and seeing who was being impacted, who was dying, it was that 75 plus group. So right now, we're just sticking with those priority groups at this moment based on that principle of, for those at highest risk, they get it. So I think until everyone in the household can be vaccinated, then we would just ask them to continue doing what they were doing pre-vaccine days, you know, doing the 3 Ws and, you know, wearing that mask anytime you're out of the house and around people that are not in your household. And hopefully that will contain it and continue to slow the spread. But no perfect solution to it. And again, I am just thrilled that we have so many community members that want to get the vaccine. But it's just going to take us time to get everybody through those priority groups.
Yep, that makes a lot of sense. Thank you.
Mm-hmm.
All right, we're going to have to move along to our other agenda items, but this was very important. And we're very grateful you're willing to come share with us, but we're also just very grateful, Ms. Stewart, that you have had such a steady, competent hand at the helm here, helping us all. And I know these decisions, they come down fast, as you are well aware, from the state, and we all have to regroup and make decisions to how to move forward best together and to keep people safe. And I will reiterate, and we'll put it back out there on social media, now is not the time to let our guards down with this new strain. Just because the vaccinations are coming out, it's going to take a while, and we need people to be ever more vigilant. The light is there at the end of the tunnel, and we just need to keep people on track. But our numbers aren't headed that way right now. We're hopeful as we work together that those numbers will come back down. So thank you, and thank you. I do know you get to work 24/7. We've had some interesting meeting times. Yeah.
Yes. Thank you. I appreciate your support, and just please keep doing what we're doing. But
let us know how we can help support you. Thank you so much.
Thank you.
Okay, great. Thank you all. All right, that takes us to our next item, which is the COVID-19 update from UNC Spring Semester Planning. We have Daryl Jeter here, who's the Director of Emergency Management and Planning, who also is on our weekly MAC calls, working together.
All right. Good evening, Mayor Heminger and fellow council members. Thank you for the opportunity for our campus to share with you where we are with respect to our spring planning, which is well underway at this point. I want to begin by, in addition to our thanks to our community partners, just share as we approached our planning for the spring semester, we did so with a listening ear, really listening to our community and learning from our fall semester. There were many things that we did right, and then clearly some things that did not go so well. So we want to move forward with increased community input and transparency, and have undertaken developing this plan, again, with that listening ear and a collaborative endeavor. So we have made changes for the spring semester, and we did so with the goal of better positioning ourselves for success, primarily for our students who are endeavoring for an educational experience. And there are going to be some things that are different this semester in comparison to the last semester. We'll highlight some of those during my presentation. So it's not going to be your typical semester. We've added a robust testing program that will allow for us to better track the spread of the virus and be able to be more responsive in a quicker manner if there's any kind of need on that end as it relates to cases among our students. And then finally, just acknowledging that it's really going to take a commitment from our entire campus community to ensure this success. So we really learned that each of our individual actions collectively contribute towards whether or not our plan is successful. So with that, first off, just to highlight some of the campus operations on campus for the spring semester. Our undergraduate classes do begin on January 19th. However, given the record number of COVID cases and hospitalizations, not only in the state, but around the country, the Chancellor did announce on January the 7th that all classes will be remote for the first 3 weeks through February the 8th. And that decision was made obviously with the health and safety of our campus community in mind. And those changes were also made through collaboration with our public health and infectious disease experts, as well as our campus stakeholders, our students, our faculty, and our employee forum. And collaboratively, there was consensus that this would be the best course to better position us to, again, have a successful experience when we welcome our students back on campus. We will not have a traditional spring break during this semester. However, in talking with our students and also understanding how this virus has impacted not only physically how it has impacted many, but it's also had a mental impact. So we want to make sure that of the physical and the mental well-being of our students, faculty, and staff. And with that in mind, we will be providing wellness days for our students throughout the semester for them to take a break and recalibrate so that they can finish the semester with success. With the pause in or with the delay in in-person instruction, we will continue to welcome students back to our campus residence halls. So they opened starting on today. And with respect to our residence halls, we are using a single occupancy approach to our housing this semester. And so in comparison to the fall semester, where we started off with almost 6,000 residential students, this semester we will have less than 3,500 residential students living on campus. With that being said, given the delayed start with the in-person instruction, residential student move-in, they can continue to move in accordance with their scheduled date. And we're also giving them flexibility if they need so to extend that up until February the 7th prior to the start of in-person instruction. As we shared the last time, we have expanded our quarantine and isolation spaces. So we have dedicated spaces for on-campus quarantine and isolation should we need those resources for our students. Our community standards have been updated, as I'll talk about in just a moment. And then also, as we mentioned earlier, our evaluation testing program, which will include re-entry testing, is underway for this semester. With respect to our community standards, as Ms. Stewart mentioned earlier, we too will continue to encourage and promote the 3 W's on our campus with an expectation of student compliance as a condition of enrollment. And so all students had to sign a student acknowledgement of those community standards for the spring semester. And we've identified and developed consistent and are developing consistent and equitable enforcement processes to ensure that we encourage adherence to those community standards. And as it relates to that adherence, obviously, we would have in place any administrative or disciplinary actions for those who may choose not to comply. That could include restricted access to our campus facilities. It could also include loss of or removal from campus housing or university housing, disenrollment from one or more of in-person courses, or fully transition to remote-only instruction, and then up to dismissal from the university or other interventions as may be necessary, because again, we want to ensure that all of our students are able to have a successful completion of the spring semester. Also, with respect to our communications, we continue to have collaborative meetings with our community partners at the county and the local level. And that includes meetings between our provost and the town managers. Our vice chancellor and our chief has meetings with leaders. On-campus student life, we have a collaborative group that meets routinely. Erin Bockenheimer on our end is partnered with many of our community partners to talk through how we can have a successful experience with our off-campus students. And then also we have monthly meetings with our public safety and public health partners. And then finally, our public information officer meets with our deputy town manager and other local and county health officials, PIOs, on a regular basis. Communication tools, our Carolina Together website will continue to be a resource that we encourage our community to take advantage of and to review if you have any questions or need additional details as it relates to our plans and the resources that we're making available for the spring semester. Also, we are refreshing our COVID dashboard for the spring. You should expect our dashboard refresh to go live by the 1st of next week. That dashboard will continue to be a resource to provide you with a sense of what our COVID cases are relative to our students, faculty, staff, and it also will provide data on our testing environment. And so our both asymptomatic and symptomatic evaluation testing. And then finally, as it relates to our housing, isolation and quarantine, so that you can keep a sense of how many we actually have in either isolation or quarantine. And finally, in that category, we'll also keep a running list of any active clusters that are on our campus in any of our housing. Spoke about testing, and so we will have prior to arrival testing for students that is required, re-entry testing upon their arrival, and then regular evaluation testing. First, our campus health will continue to provide testing for symptomatic and close contact testing for our students. And they also have, for this semester, testing response teams so that if any on-location testing is needed in our campus or Greek housing, we would be able to mobilize those teams to bring that testing resource on site for those locations. Rapid molecular testing is now also available. This is particularly going to be beneficial for providers when they have to make a differential diagnosis of whether it's COVID, flu, or some other upper respiratory infection. And so we're grateful to also have that resource. We are very excited about the launch of our Carolina Together testing program. And so this will include free asymptomatic testing for not only our students, but our faculty and staff as well. We have 3 locations that will be operational to provide this testing at the Carolina Union, the current art space at Carolina Square, and Rams Head Recreation Center. And we actually initiated this testing program this week. It began at the Carolina Union. We'll be standing up the 2nd location at the current art space this weekend, and then our 3rd location on next week on the 19th, on Tuesday the 19th. We will be closed on Monday in recognition of Martin Luther King holiday. We also want to just recognize just the amount of support that we've received for this. And so our students have really stepped up to support this endeavor. And so we have a volunteer corps of 450 student volunteers who are assisting with all of the logistics that are associated with processing individuals through capturing the test, as well as our testing lab so that we can process the lab results. And on our website, we do have this chart available that provides an overview of the testing program, which lists the groups that are required for mandatory testing and what the frequency is, as well as those who are invited to participate in weekly testing, and for our employees, the daily symptomatic checks that they have to perform on a daily basis. And so we invite you again to take advantage of that resources for more details on the frequency by which our campus community are required or invited to participate in our evaluation asymptomatic testing. And then finally, I wanted to highlight, vaccination planning. And so we are participating with Orange County's vaccination task force with participation from our Environmental Health and Safety Department, as well as Campus Health. We're providing resource support. We're pleased to be able to support both the county and the hospital with vaccination sites. And so again, we are very excited about the partnership and we believe that this is a demonstration of our collective commitment to make sure that we successfully navigate this COVID vaccine so that COVID environment so that we can return to normal as quickly and safely as possible. And then finally, as it relates to our campus health, we have applied to be a vaccination provider for our students, particularly for the phase 3 once we enter into that phase. We're coordinating the planning efforts for any mass vaccination that will be entailed in that endeavor. And that we also understand that it is important that our students and parents are educated and clearly understand the prioritization of administering the vaccine so they'll know when they can expect and anticipate this resource being made available to them based on the prioritizations that have been provided. Also, test and response, we've covered that information from Campus Health. And with that, I will say, we just, again, want to thank you all for the continued partnership that we have with our local partners. And we, again, look forward to welcoming our students for a successful spring semester. So with that, I will yield back and be happy to answer any questions that you may have.
Thank you, Mr. Jeter. And if we can get the full screen back, thank you very much. All right, we'll start off with Ms. Gu. Then Ms. Anderson.
Okay, well, thank you very much for the presentation. I think that UNC has such a huge footprint in our town and in our community. So whatever UNC decide to do, it always have a significant impact, and there are lots of community interest in this. I think as we all have seen, that this plan is a significant improvement over what we had in the fall, and we certainly hope that we we will have a much better outcome coming out of this as we getting more experience and know more about this virus and know more about our students in the larger community. So in addition, as I know there's so many moving pieces, but can you emphasize the piece about like off-campus housing or the activities or behavior of the off-campus students, how they're going to be tested, how you're going to monitor their behaviors, or how are you going to enforce those community health guidelines? Can you like focus on that area and give us a more detailed plan of how you're going to manage that?
Certainly. So as I mentioned earlier, our student affairs continues to have ongoing collaboration, both with campus police and our community partners to ensure that there is a partnership with those who are residing in Greek housing. And so inclusive in our testing program requirements are those who live in off-campus housing and will be participating in on-campus activity or instruction. And so those will be a part of the group that will have the twice a week requirement to go through asymptomatic testing. And we do have measures in place. We have a resource, an application for students that will track and to ensure that they are meeting their requirements of being tested on that frequency. If they happen to miss a test, whether accidentally or otherwise, we have mechanisms in place where we can reach out to them so that they can correct that. And as I listed earlier, some of the measures that we would be prepared to implement, whether administrative or disciplinary, we would certainly be prepared to administer those as appropriate should they not or should they continue to not comply with the community standards, which includes the testing. So yes, that does include our off-campus housing as well.
So when you say off-campus housing, do you include those UNC students that live in our apartments? As you've seen that in recent years, we have significantly expanded the availability of off-campus apartments around the town. Is there any plan to include those students?
Yes, so all students who will be living in the Chapel Hill or Carver area, even if they are fully remote, they are expected to participate in our evaluation testing.
Are they going to be tested twice a week? What category are they in?
Yes, they will be under the category of once a week testing.
Okay. So for those informations, and also the community, of course, has a lot of questions. They want to know what is going on and what the testing results are and all those things. Are these informations, of course, including like violations or enforcement? Is there a website or some other means that keep the community informed about how things are going on campus or off campus?
Yes, so as I mentioned, I think the last time that we had the opportunity to share, we did launch a new endeavor where we're providing at a minimum on a quarterly basis and potentially even more frequently a list of or an informational essentially as it relates to our campus environment and any violations and what that environment looks like in that respect. And so we're hopeful that that will be a beneficial resource for our campus community. Information on that and how to access that will be made available on the Carolina Together website. And I can, subsequent to this meeting, certainly share direct links and information to make available to the council members as a follow-up.
Okay.
Thank you. Ms. Anderson?
Yeah, thank you. So my first question was just a clarification. When you showed that chart, you said that there were things that students were either invited or required to do, but it sounds like the twice weekly testing is required. What would they be invited to do? Is that just doing testing for symptomatic cases?
So for clarification, the two populations who will have voluntary testing, and that's what I was referencing when I said invited, those would be our faculty and staff. And so they would be able to participate in this testing on a weekly basis, but they are going to be required to do mandatory testing. The other category would be graduate and professional students or postdoctoral fellows that may be living in the local area, but they're not accessing our campus or living in, clarify that, they're not participating in on-campus activities, not accessing campus, nor are they living in the Chapel Hill or Carrboro area. So that population of graduate and professional students would be able to test voluntarily once a week, but all other students would have either a once or twice a week mandatory testing requirement.
Thank you. That's really helpful. I thought I understood and then I got confused and now I'm back. So my next question is, given that today there was a reported cluster at Carmichael Residence Hall, and this is our first day of students being back, I'm just wondering, is this changing how you're approaching reopening? And by you, I mean, decision makers. I don't mean you individually, but what changes are being made given that it looks like there's a lot more robust system in place, but yet we still have a cluster on the first day. So I'm just wondering what changes are being made in response to that.
Thank you for raising that question. And with regard to the cluster announcement from today, I do want to emphasize, and so that was a part of our student population that was already on campus. We did have a population of international students, students who had received hardship approvals, and our athletes who remained on campus even through the holiday. And so it was a part of among that population of students that the cluster that was announced today was applicable to. We anticipated going into the spring semester that we were going to have positive cases. And so that's why, the other measures that we talked about earlier, the expansion of our isolation and quarantine, as well as putting in place our Carolina Together testing program, all of those measures and emphasizing and really encouraging compliance with our community standards for our students, we believe will help all of us be more successful in the spring semester. So we will continue moving forward with welcoming our students. At the same token, we are keeping close eyes on and certainly watching data as it unfolds both at the state level, the county level, and on our campus.
Thank you. In terms of traveling off campus, so I know that there's no spring break, but are students allowed to travel away from campus once they're here for school? And if so, do they have to show a negative test before coming back on campus?
That is a great question. I don't want to misspeak on the particular requirement. As was indicated or implied with our prior to arrival testing for the spring semester, that is the spirit of that particular requirement. And so in not having a spring break, we're really discouraging the travel. However, if they do have to travel, we have the testing mechanism both before they return back and then upon their return, so that we can ensure that they are clear to continue to experience the campus environment experience.
So students will get tested before they're allowed back on campus if they do have reason to travel. Is that right?
That is my understanding.
Okay, thanks.
Mhm.
I guess my last thing would just be a plea that to please pass along that, of course, as we've seen, we are all impacted by each other, and that it has been really challenging to understandably, as 18-year-olds do, the off-campus behavior has been a lot trickier than on campus. My 7-year-old is still not in school and she doesn't go to frat parties. So this has a huge impact on our community. So I'm just really hoping, I know that the university has not been willing to share what metrics will be used or when the off-ramp will be taken exactly, and that it's a complicated decision. But I would just, again, urge leaders to remember that there's a huge, huge impact on our community, and it's felt some places harder than others. Being out of school is hard for everybody, but it's really hard for our most underserved and under-resourced populations. So so please do keep in mind as things go forward, if we find ourselves in another unfortunate situation like last semester, to please take the off-ramp quickly. But thank you for coming and sharing with us and keeping us informed.
Thank you.
Mr. Parker?
Thank you, Mr. Jeter, for coming, and we really appreciate all the work that you and your colleagues are doing to try to make this work for UNC, and as Ms. Anderson said, for our entire community. A couple of questions. First, in terms of quarantine and isolation, is that available to off-campus students who, test positive or whatever, or is it reserved strictly for folks in on-campus housing?
That is primarily for our on-campus housing residential students. However, we will work closely with our off-campus students to ensure that they have the necessary support resources should isolation or quarantine be in need of theirs. So again, any resources that we have that we can extend and make available to them, we will work closely with them to make sure that they have that support.
And I'm sorry, and second, getting back to what was clearly an issue in the fall and the behavior and the Greek houses. What specific steps have been taken to ensure that the kinds of bad behavior, for want of a better term, that we saw in the fall won't happen again? I mean, it's last time there was there was certainly an attitude that what happened in the Greek houses was beyond the control of the university, and so that seemed to be one of the primary seeding sites collectively for the spread ultimately back into the dorms. So what specifically is the university doing to, as much as possible, get better behavior out of the Greek houses?
Well, I want to begin by my response by saying the fall semester was an educational experience for all of us. And so the entire campus community—
tuition was pretty high.
And so the impact of the fall semester for our students was felt. And we strongly believe that they have a recognition that, as we said earlier, it is going to take all of us working together to ensure that we have a successful spring semester. That being said, we recognize that there may be some decisions not to comply with those community standards. And so, as I outlined earlier, their acknowledgement of the community standards and lack to adhere to them would position them to be open to those administrative or disciplinary actions. So we've had communications with our students, ongoing communications with our students who plan to reside off campus to make sure that they clearly understand what those expectations are, including the testing requirements and other measures, so they understand the consequences that would be in place should they not comply.
And I guess my last question relates to opening dormitories versus vis-a-vis on-site versus remote classes. I mean, every evidence from the fall suggested that the classrooms were not the place where things were spreading. That was not the problem. It was basically, bad behavior elsewhere and then spread through the close living conditions in the dormitories. So I'm kind of confused that rather than keeping people out of the dorms, you're basically keeping people out of the classrooms. And so it's because it seems like it's the dorms where things spread, not classrooms. So could you explain the logic there? Why you think that not having in-person classes, but still allowing the dorms to be as occupied as they're going to be, recognizing there'll be single occupancy, is the way to go?
Yeah, so I will just reiterate your last point, and that is a major change from the fall semester, moving to the single occupancy to help ensure that we minimize any close contact. I will say that measures in place for rules and regulations in our housing environment will be strictly enforced and we will not hesitate if there is a need to do so to ensure that if a student is not complying with those measures that are in place to surroundings such that they can convene in their learning. And so again, we continue to monitor. We'll take those measures to make sure that we're safeguarding those students, and we trust that the plans that we have put in place, including the reduction of occupancy down to single occupancy, will better position them to minimize the spread or access to exposure to the virus.
Okay, thank you.
Okay, a few more questions and we'll have to wrap this up. Ms. Stegman, followed by Ms. Ryan.
Just a quick question. Thank you very much for this update. And it's great to hear that the Student Conduct Office is, going to be following up with students, and that seemed to be increasingly effective last semester, and we know that's an important part of this process. But I'm wondering, that's such an important function, and given that the follow-up is around potentially outbreaks or bad behavior that could cause outbreaks, timeliness is going to be incredibly important in terms of follow-up and behavior change. Could you talk about the staffing for that office, or if extra support will be provided to ensure that that follow-up happens quickly enough to prevent outbreaks or spreading and other things we are trying to avoid?
I can say generally, and I can't provide specifics for you, but generally as it relates to our student affairs staff, including housing our NINA students and our student conduct offices, that they certainly have looked at the staffing resources that are needed to ensure that they're able to maintain the ongoing engagement with our students who are living off campus and in Greek housing. And so, again, those are all some of the lessons learned from the fall semester and adjustments made for the spring semester. So we fully support and want to make sure that they have both the staffing resources as well as the technology and other resources so they can have that ongoing engagement and track those encounters with our students so that appropriate follow-up with the students to both incentivize good behavior and discourage bad behavior can be applied.
Thank you.
Ms. Ryan?
Talked about having resources available for students on campus who need, or for off-campus students who need to isolate. Is that support or is that actual room space?
That is actually a combination. And so our student affairs actually will work with our off-campus students to make sure that they have both space for occupancy for isolation or quarantine, as well as the support resources, both mental health support and the physical support while they are in isolation or quarantine.
Okay, and some of that physical support would, I know, would, like if they need help getting food or that kind of thing, would that be something they would provide?
Those are all resources that our student affairs would work closely with those students to identify what those needs are and help to fill those needs.
Okay, because I would say whenever possible for them to be in actual dorm isolation space is preferable. I know that a lot of the spread that we're seeing in the community is within households now. It's one member who goes out, gets infected, and comes in and infects the other four. So just whatever the university can do to help those students isolate effectively would be great. Second comment is, I think we need strong messaging around encouraging students to stay in the campus or off-campus bubble for the entire term. I know that you can't mandate that students don't go anywhere, but somebody who, say, goes home, they're from Raleigh, they go home for an evening, they have a big family dinner, they come back to campus, they can't test upon getting back right away because that test result would be meaningless. And those sort of family things can be big spreader events. So either making sure that they know that they have to isolate when they get back, or actually they have to quarantine when they get back, or setting some standards. But I think being really clear with them about traveling doesn't mean going somewhere down to Florida for a trip, right? It can be going home to your family for a Sunday dinner. And that also, then here's what we expect you to do when you come back. I know my family has had some issues lately with this, and I was very surprised at the lack of understanding of in my family about what kinds of things they should be doing, when it was okay to get tested, when they needed to, what sort of contact was okay and wasn't okay. So it's still a big communication challenge. And my last comment would just be continue the one community message. I know we're really pushing that, and making sure, like for instance, masks. I know you require masks on campus. We need them downtown too. We need all of those good behaviors that you guys are establishing on campus to flow out into the community as well. Thank you.
Thank you.
Mr. Dieter, I know that when we were talking about how many students were actually physically present in our community, last semester, you guys did a couple of different data grabs to see where IP addresses are. Do you have a rough guesstimate of how many students are, I know they're not all here yet, but what you're expecting to be in the community, local, I guess, between the dorms and the communities of Chapel Hill and Carrboro? I know some students are in Durham as well, but do you have any indication yet of what percentage or how many students that would be?
I don't have that information, but I'm making a note to follow up.
Thank you. I know we looked at it later when you guys did the off-ramp. We looked later and they were able to see that a lot of students, number stayed here, but a lot of students actually went back to their original home across the state. So it's just an interesting concept to see, especially when you're doing mandatory testing, about how many we actually are talking about here in the community. So thank you. If you'll stay with us for just a minute, I don't think anyone signed up to speak on this item, but if anyone's wishing to speak on this item, they can use the raise hand function or the *9 function on their phone. Put that out there. Okay. Well, we really do appreciate you coming to talk with us, but mostly we appreciate that we have great partnership. We're in constant communication at different levels for different items on different things about working together. The banners are going up downtown all together, is the statement that we are in this all together. And we want to make sure that people understand, and especially our students. We love our students. We welcome our students to be part of the community. You are part of our community. But we also need to recognize about keeping people safe. And one of the deadliest things about this virus is that you can be asymptomatic, not know you have it, and spread it to someone who will not be so fortunate. And so that's the scary part. And that's why I think people worry about people who tend to be asymptomatics are the people in the student category. So we just want to be in this together. And that means everyone needs to continue to practice the 3 W's, and mask wearing is one of the most important components, but staying 6 feet apart, using good guidelines, understanding that, you need to bubble in some sort of way with some group of folks so that you're not bringing cross-contamination from other groups. So we appreciate working. I know we'll continue to have meetings working together as we have been, but we appreciate you sharing with us this evening. And I do know that you guys all met with the national epidemiologist about deciding to delay your in-person classes and best practices. So I know you're not just counting on your own inside information, you're really reaching out to get fact-based information, and we appreciate that. Thank you very much.
Thank you for the opportunity.
Thank you. Okay. That moves us to item number 11. This evening, we're considering amending Chapter 10 of the Town Code to add a non-discrimination ordinance. And you're going to hear from me first on this, and then we have some folks sign up to speak as well. And then I know there's some council members who wish to speak on this topic. So let me share with you and type this out so I don't forget anything. So bear with me, please. But on December 1st of 2020, a key provision of House Bill 142 expired. That's the North Carolina House Bill 142. House Bill 142 was a North Carolina legislation that replaced the anti-LGBTQ House Bill 2 from 2017. Now that this provision has expired, North Carolina joins 47 other states in allowing local governments to adopt ordinances protecting LGBTQ residents from discrimination. Tonight, we are considering amending to our Chapter 10 of the Town Code, which will add a new non-discrimination ordinance. As a town, we are committed to being a welcoming, inclusive, safe, and supportive community for everyone. To live up to these aspirations and to allow everyone to thrive, we need to be free from discrimination. But as things stand, there are gaps in protections for the LGBT community and some other categories that need to be addressed. For instance, last June, the U.S. Supreme Court held that a section of the Civil Rights Act of 1964 protects employees against discrimination because of their sexual orientation or gender identity. But that legislation does not cover working for businesses that have fewer than 15 people, gig economy positions like rideshare drivers, and independent contractors. Additionally, our new ordinance covers protections that do not exist for services offered in places of public accommodations, such as stores, hotels, and businesses that supply goods and services on the premises to the public. Historically, the Chapel Hill Town Council has consistently passed resolutions affirming the dignity and rights of the LGBT community. In doing so, our community has called for and demonstrated strong support for the town to be a leader in matters of equality, inclusion, and fair access for everyone. Tonight's vote will marks an immediate positive impact on the lives of many in our community, and therefore marks an important step forward for our community. And before we move on to get clarifying questions and hear from the public, then I know I said some council members wish to make some statements. I want to thank Mayor Lavelle from Carborough for her leadership on this issue. She, along with our municipal attorneys, the county attorneys, did a lot of work to get us ready for this, and we are grateful for that. I also want to thank the members, gay members and lesbian members of our elected officials. They have met too and been working and helped inform us. And then I want to really thank NC Equality for their advocacy and work to make North Carolina inclusive and safe for everyone. There's a lot of work that's going on behind the scenes. We bring this to council tonight. And like I said, we're very proud of moving forward to give equal opportunities to everyone. So that being said, I know that our town attorney has been working really hard. She's here to answer any questions if you have clarifying questions. Our town manager has been involved. We've had a lot of folks involved in doing this. And I know that you know that the elected leadership of the 4 jurisdictions in Orange County have been working collaboratively as we share similar values. The town of Hillsborough passed this ordinance on Monday evening. The town of Carborough passed this ordinance on Tuesday last night. We are proposed to vote this evening, and Orange County will be voting next week at their business meeting. So are there clarifying questions from folks before we hear from the public? Great, thank you. All right, Mr. Parker, will you help bring in our speakers for this evening? And if you're wishing to speak and haven't already signed up, please use the raise hand or the *9 and we will call you in. We want to hear your comments. We do ask that you try to keep within the 3-minute mark to give everyone fair access to speaking. And we're glad to have you with us this evening. Mr. Parker.
Yes, we have Terry Phoenix, followed by Donna Jones.
Welcome.
Hi, my screen glitched out. I heard my name.
Yeah, we can see you and hear you.
Okay, all right. Great. So thank you very much for the opportunity to speak to this tonight. And first of all, my name is Terry Phoenix, and I do work in Chapel Hill at the university. I identify as a white transmasculine queer parent. My pronouns are T or he, him, his. And again, thank you for the opportunity. I wanted to share a little bit of data that is relevant to this ordinance because I think it is critically important that we pass it. Approximately 4% of the North Carolina population identifies as LGBTQ, and that would be equivalent to just under 3,000 people in Chapel Hill. And as Mayor Heminger referenced earlier, the Supreme Court recently affirmed that Title VII of the 1964 Civil Rights Act protects people from employment discrimination on the basis of sexual orientation and gender identity. However, there are exemptions in those employment protections, and there are no federal or state protections regarding public accommodations. So this means that I and my family, when we want to go to a restaurant or a movie theater or a hotel or be seen by a doctor, we can be denied service and asked to leave in those situations, and we have no recourse. So, you know, and this happens especially for transgender individuals. There was a recent study done by the National Center for Transgender Equality, and I want to share with you some of the data from the 686 North Carolina residents that participated in that study. So a couple of data points. 22% experienced housing discrimination, such as being evicted or denied housing because they were transgender. 62% avoided using a public restroom in the past year because they were afraid of confrontations or other problems they might experience. And that can limit severely your participation in the community. Of respondents who did visit a public venue, 12% were denied equal treatment and 16% were verbally harassed because of being transgender. And police are not always helpful. In fact, in this data of respondents who interacted with police or law enforcement, 54% experienced some form of mistreatment. And lastly, 29% of those who saw a healthcare provider reported having at least one negative experience or being denied service because of being transgender. So this ordinance would send a message to the community that LGBTQ people are a valued part of the community. That is probably one of the most important things about this, but also it would give some legal recourse for people in the event that they did experience harassment and discrimination. So I thank you for considering this. I thank you for the opportunity to address you, and I hope that this passes tonight.
Thank you.
Okay, we have Donna Jones followed by Mark Kleinschmidt.
Welcome.
Good evening, everyone. Thank you for having me. It is great to follow my colleague, Terry Phoenix. I'm Donna Jones. I am the president of the Chapel Hill Carrboro NAACP. I also live and work in Chapel Hill, and this ordinance means a lot to me, and I would like to read a statement on behalf of the branch. The mission of the NAACP is to support marginalized groups and oppose discrimination in all its forms. Therefore, the Chapel Hill Carrboro NAACP stands firmly in support of the proposed ordinance as we recognize and affirm that no individual should be discriminated against based on their sexual orientation, gender identity, or gender expression. As Chapel Hillians, we are the leaders of progressive values in the state of North Carolina. The Chapel Hill Carrboro NAACP calls upon each of you council members to vote in alignment with those values and extending non-discrimination protections to our LGBTQ brothers and sisters living and working in the town. Thank you.
Thank you.
Okay, Mark Kleinschmidt followed by Lee Storo.
Welcome.
Thank you so much for having me, Mayor. Those were extraordinary words, and I'm so pleased to hear about the level of cooperation between all the governments here in Orange County to make this week happen. I thought I would address you just for a moment about your role in bending this arc of justice tonight. It was more than 25 years ago. It was about 25 years ago when Chapel Hill and Carrboro became the first towns in North Carolina to offer domestic partner benefits, recognizing the relationships of gay and lesbian people. It wasn't until 2003 that Durham became the third municipality in North Carolina. By then, I was on the council, and the Chapel Hill Town Council was considering adding gender. It did add gender identity and gender expression to its non-discrimination ordinances when it comes to the provision of municipal services. And it called for the first time for a repeal of the Defense of Marriage Act. This council that you're a part of has stood at the cusp of history on LGBT equality and has led the state, and you do it again tonight. It's an extraordinary moment. And I'm even talking to you now with a quiver in my voice and a shake in my body, because every time I've ever talked about equality issues, LGBT equality issues to the town or through this council, it's always made me nervous because it's been intensely personal. And it is that way for so many of your constituents, because we are a community that welcomes people, and it is committed to doing so. And it brought tears to my eyes to read the proposed legislation, the ordinance that I did earlier today, and so grateful for the work that you're all doing. I also know that you're being reached out to by a lot of people who have a different opinion, whose opinion is many of whom whose opinion is based on faith. And I just wanted to share with you, as a person of faith, I mean, I'm somebody who goes to church at least once a week, often more than that. And one of the things that resonates with me in my faith is the hospitality of Christianity. And it is what's one of the things I'm most proud about our community is that it lives that part of the faith, open to everyone. And if there is a barrier, it works to break it down. And tonight, we take another step to being a community that welcomes the stranger in, rather than becoming part of the mass or the horde that yells for their extraction. I want to thank you so much for taking this moment. It was the ability to extend non-discrimination to public accommodations and to employment was something that we've worked so hard to achieve. And in my entire professional I'll just say it, since puberty, my life has been dedicated to trying to make this happen. And I'm so moved by your commitment and the commitment of all the great elected leaders in this county. So thank you tonight for your support of this and your willingness to jump on this so quickly. Thank you for allowing me to have these few moments.
Thank you.
Okay, Lee Storo, and I am not seeing anybody after Lee.
Welcome.
Awesome. Like Mark, I just wanted to come on and briefly speak during this public comment to the importance of this moment and the history of this moment. I'm Lee Storo, been a resident of Chapel Hill for more than 10 years, been active in local government, and currently work professionally doing HIV and hepatitis advocacy work in North Carolina. I think all three of the speakers before me really made the case on why this is important. Chapel Hill has a history as an open and inclusive space. But as I think we all know, sadly, these topics stay controversial. And we know that there may be comments from folks living in Chapel Hill, probably a minority, and from comments from folks across North Carolina who are speaking out against this. So want the council to know that you're doing the right thing and moving this ordinance forward and passing it tonight. And just wanted to take a moment to speak in my current capacity of the work I do around HIV advocacy. You know, we know that segments of the LGBTQ community, specifically gay, bisexual, and same gender loving men and trans women, especially when those folks carry, you know, multiple marginalized identities, particularly when we have folks who are from communities of color, they face stigma, they face non-discrimination, and that leads to so many negative health outcomes, so many negative outcomes that we all want to avoid, right? Like it leads to greater rates of HIV, it leads to greater rates of suicide. And by passing ordinances like this, we really send a signal that helps stop discrimination, that helps stop stigma, and it's just really the right thing to do. So thank you all for considering this, and thanks for your vote tonight.
Thank you.
Okay.
I think that's all that signed up.
Yeah, there are nobody else has signed up, and there are no electronic hands raised. So.
Great. Okay, thank you. So I bring it back to council for comments. Ms. Stegman.
Well, I'll be brief. I really appreciate the really moving comments from the public. It's very appreciated. And I just want to say that this is a vote I've been waiting for 3 years since I joined the council. And especially at a time when leadership is failing us so visibly and disappointingly at the federal level and at the state level. Local action is all the more important. And I'm just so proud that after this vote, I will be able to say to the LGBTQ community including my wife and my kids, that from this day forward, not only are you welcome, but you are safe and you're protected in Chapel Hill. And that means so much to so many people, I think. And I also just want to quickly add to the thanks to Mayor LaBelle, to Councilmember Stiles and Corborough for their leadership, both locally and at the state level, to move this forward, and to Hillsborough for taking the lead, and to our attorney who had a very long to-do list and still got this done in time for the meeting tonight. So thank you to everyone who helped us to bring this forward. Really appreciate it.
Thank you. Mr. Boynton or Mr. Parker?
Yep, I just want to thank the mayor and especially Councilmember Stegman for her advocacy and leadership on this proposed ordinance. This is a really proud moment for the town, for our community. We're paving the way for our state, and I am so proud to serve alongside Ms. Stegman, whom I liken to the late Congressman John Lewis. She's the moral conscience of the council, so thank you.
All right. Mr. Parker and Ms.
I
Key?
just want to also thank everybody, both in the council, the mayor, council member Stegman, our attorney, Ann Anderson, for doing all the hard work to make this happen. It's just so important. And it feels, for me at least, coming a little bit full circle. One of the early things that I was involved in shortly, within the first 6 months in office on council, was passing a fairly scathing resolution against the General Assembly for passing HB2. So it feels like closing a circle now in terms of my tenure, being able about 4 years later to be able to pass an ordinance that does exactly what HB2 tried to stop, which is, prohibit discrimination, make all feel welcome, and do the right thing for everybody. And I'm always sort of with mixed emotions, because I'm always proud to do these things. And I'm also always very sad that we need to, but we do need to. And so I'm really glad that we're able to tonight.
Ms. Gu?
Well, I just try to be really brief, and I think this ordinance, it really affirms our value as a town, as a diverse and inclusive community. And I'm hoping that all the people of our town, the minorities, the immigrants, and today the LGBTQ community, that will now feel safer and better protected in our town's community. But at the same time, I want to say that there is no piece of legislation that will be able to eradicate discrimination unless that we're able to change the hearts and the mind in each one of us. So that means that as a town, we need to, through our housing policies, through our land use, through all the transportation policies, that we're intentionally to create spaces, to create opportunities for people to come together, to understand each other, to share their life experiences. I think that is crucial parts that we need to do to really help people to understand each other, to respect each other, and to respect our differences, and treat each other as a divine children of God. So I think that is very important for us to come together on this. And I think, like Maya Angelou said, I'm a human being, and there's nothing human is foreign to it is alien to me. So we need to see that, and to see that our differences should not be the reason that separate us and divide us. It should be the reason for us to see the difference. Through the differences in each one of us, and we see the strength, and we can overcome our discrimination and the fear toward our differences, and coming together as a community, and to be stronger both at each individual level and at the community level.
Ms. Ryan?
Lost the mayor. I just wanted to say I'm so proud to be here today as Chapel Hill takes this important step to honor our values and vote on a new non-discrimination ordinance that will make equal treatment for everyone and explicitly our LGBTQ friends and family members and neighbors the law of the town. I'd especially like to thank Mayor Heminger and Mayor Lavelle for their proactive leadership, and to the other Orange County officials and staff members who have made this ordinance possible and are helping us show the way forward for North Carolina.
I'll bring it back and then we'll come back for a motion. This has been an honor to work through this. It's also been very personal for me. In this day of COVID, where my gay son is an ER resident and puts his life on the line every day to treat people, there is no reason he should be expected to be treated differently or not get a hotel room or any of those kinds of things. And I want to fight for a just world. I'm proud of this community. I'm proud of this council. I'm proud for the collaborative work we've been doing together, where everyone has equal rights and everyone gets the respect that they deserve. And so I'm very, very pleased that we've taken this step. HB2 was passed just a few, within the first 100 days of me coming into office, and I was completely horrified and frustrated, as we all were, because we didn't know what to do about it. So here's our opportunity to do something, to take a stand, to show that we care. We are very hopeful, and the Orange Leaders will start to trend of more communities stepping up and saying what is right to do. So with that being said, I'm going to ask Ms. Stegman to make the motion. We do need a date certain that this ordinance takes place. So you get to make the motion. So you pick the date, Ms. Stegman.
I move we pass the ordinance effective January 13th, 2021.
That's right.
Second.
Mr. Boyncey is seconding that motion. That is wonderful. Thank you. All right. I will take a very proud roll call. Mayor Pro Tem Parker.
Absolutely, yes.
Ms. Anderson.
Enthusiastic, yes.
Mr. Boyncey.
Yes, with pleasure.
Ms. Goo.
Yes.
Mr. Nguyen.
Big I.
Ms. Ryan.
Yes.
Ms. Stegman.
Heck yeah.
The mayor says enthusiastically yes. Here we go. All right. The ordinance is passed unanimously, and now we have a comment from our attorney. Hope she's not going to make us do something different. Here we go.
I'm sorry to break protocol by asking to speak. I realize this is very, very brief. I actually expected to be answering a lot of technical and questions about this, and thank you for there not being any. But I did want to say, I just want to thank you for allowing me to be part of this. It's not every day that in the legal profession, you sort of go to sleep thinking this was a great day as a lawyer. But this is one of those great days. So it closes a lot of loops for a lot of us, but for those in the legal profession, it closes a particular loop as well. So thank you very much.
Thank you for your hard work. I know it's been quite a collaborative effort to get to where we are. Okay. Congratulations, council, and way to stand up for our community. Proud of you. Okay. I'm sorry. That brings us to our next item on the agenda, the Awasa Long Range Water Supply Plan. And we're have tonight with us. I saw Ruth Rouse is going to be presenting, but I saw Todd here as well. Todd Taylor, there you are. You're both here tonight. So thank you for coming to speak with us.
All right, thank you. I'm going to try to share my screen here. Can you see that? Or
we can, thank you.
Okay. Oh, but it didn't switch to print there. Now you can see it in presentation mode, hopefully. All right. Thank you very much for having us this evening. As Mayor Heminger pointed out, Todd Taylor, our Executive Director, is also with me this evening to answer any questions. We really appreciate having time on your agenda. I know you're all busy. What we're talking to you about this evening is the update to our long-range water supply plan. And it's really important to us to bring this to you because it is one of our strategic initiatives. And what we want to get out of this evening is just provide information to you on the work that we've completed to date and get your feedback and questions on that work, as well as get any feedback and thoughts that you have as we move forward on this project. So there's three key messages that I have for you this evening. One is that it's really good news. We're at a really low risk of running out of water for the next several decades. The second key message is that we do have a vulnerability, and that's if we got into an extended drought, and that is something we feel we want to address, particularly in light of climate change. And the third point is that out of the alternatives that we evaluated, that Jordan Lake appears to be the most cost-effective option for increasing our resiliency. I wanted to bring this figure to you, and it shows our process for developing the long-range water supply plan. I'm not going to step through the whole thing with you, so don't worry. I want to point out two key things. One is that it's a circle. So we will go through this again. Every 5 to 10 years, we will look at our demand projections and see, do we need to rethink our long-range water supply plan? The second key point I wanted to point out is we are currently at step 7, and that is the community engagement process. We started this in October. We appeared on the Wonderful Water segment that Awasa has with Aaron Keck, and advertised a webinar that we did with the community in November on the long-range water supply plan. And then we are doing these meetings. We met with the town of Carborough's council last night, you this evening, and then the Board of County Commissioners in February. And we will take the information that we gather from you back to our board. In addition, we just felt that these public forums with the elected boards was another opportunity for the community to hear about it and to know how they can also participate and provide comment to Awasa. Just to make sure everyone's on the same equal playing field here, I wanted to also let you know, where do we currently get our water from? We have 3 local water supplies here in Orange County: Cane Creek Reservoir, which is out at the western part of the county, and then University Lake, which is in Carborough, and then the Corey Reservoir just out Highway 54. We also have an allocation of water from Jordan Lake, which is a federal multi-purpose reservoir. One of the purposes that Congress designated for it is water supply. And Awasa has had an allocation of water from Jordan Lake since 1988, which was the first round of water supply allocations that the state made. However, our practice has only been to use it during water shortages and emergencies. And I do want to point out, we don't have a way to guarantee access to get to that Jordan Lake water at this point. We do have mutual aid agreements, but they don't guarantee that access. And this is a graph that I wanted to show you because I think it plays into some information I'm going to provide in a little while. But the blue line on this graph shows the number of customer accounts that Awasa has had over time. And you can see that it's consistently going up, which means that our service area is growing. The green line are water sales in million gallons per day. And you can see that they peaked in the early 2000s and they've gone downhill since then. So our customers have been conserving. And that started post-drought, which we had in 2001-02, and then in 2008. Our customers changed their behaviors and they've continued to keep those behaviors post-drought. Awasa has implemented seasonal rates as well as increasing block rate schedules, which help encourage conservation as well. And one of the big things that has occurred is that in 2009, a reclaimed water system came online that we partnered with UNC on. And that reclaimed water system does meet over 10% of the community's water needs at this point in time. Not shown on this graph is that Awasa also recycles water at its water plant. We do require water to treat water, and that saves about 7% of the water that we would need. So between the reclaimed water and that recycle system, we're saving just under 20%. This is our good news graph. So the blue line on here shows the yield in 1989, when Cane Creek Reservoir came online. Our yield went up to 10.5 million gallons per day. And then we have plans to expand that Corey Reservoir. And when that Corey is expanded, we'll go up to about 12.6 million gallons per day. And then we can see our historic demands in the black diamonds. And then the black line is our baseline projected demands looking out 50 years. However, we recognize that we have a lot of uncertainty when we're looking out 50 years. So our consulting engineer did an uncertainty analysis, and those gray bars or that banded area is our expectation for our demands over the next 50 years. I do want to point out, it looks like we have no uncertainty in the yield, and that is not true. If we got a new drought of record, that line would come down. And there's other things in our model that we have uncertainty about. So our water supply risk is low, as seen on that prior graph. And I really want to give heedance to our predecessors who set us up well in terms of supply. You know, they purchased the Quarry Reservoir in 1979, and in the 1980s, we got the allocation of water from Jordan Lake, and Cane Creek Reservoir was constructed and came online. Also in terms of conservation, that reclaimed water system and our customers just doing a wonderful job of conserving water. However, our vulnerability is the size of Cane Creek watershed. The blue lines on the map show the watershed boundaries for Cane Creek Reservoir as well as for the University Lake. The University Lake watershed also kind of shares the western part of our service boundaries shown in red. Each of those is about 30 square miles, but Cane Creek Reservoir holds almost 7 times the amount of water that University Lake does. So that means when we get drawn down in drought, if we have another drought hit before we've recovered, that could jeopardize our water supply. And that is the risk we take. And that is something that, because of climate change, we feel like we do want to address that. So we looked at several different alternatives to meet our long-term needs, and we evaluated each of those against the pillars of sustainability. And we started out with just any big, hairy idea was on the table, and we came up with those in part by meeting with the local government staff as well as UNC staff, things that we had heard from board members, plans, neighboring utilities as well. And then Awasa staff narrowed that field, kind of doing back of the envelope type calculations, and brought that to our board. And that's where we came up with a list of strategies that we evaluated in the long range water supply plan, where we did more of an apples to apples comparison. And our alternatives fell into 2 main buckets, and one is demand management alternatives. Those are things that encourage conservation or result in us using less water. So on that good news graph with the gray shaded area, that shoves or moves that gray shaded area down. We also looked at supply alternatives, and on that gray, or on that graph, it moves that blue line up. Starting with the demand management alternatives, those kind of were at a no-go because they either were just not cost effective, particularly when you look at them at the price per gallon of water saved, or they just don't move the needle very much in terms of how much water they save. And that is in large part because of the efforts that the community has already made in terms of conserving water. However, we recognize that there is a conservation ethos in this community, and we want to further support that. So the cost-effective strategies we will consider in a water conservation plan that will be an appendix or a companion document to the long-range water supply plan that the community will have an opportunity to look at. In terms of supply options, we already have plans to expand the quarry, and then we also looked at putting new intake structure where we could get water from deeper depths. And that doesn't increase the water supply very much by the shallow quarry, and it has a high capital cost, particularly when you look at it in terms of the amount of water that it provides over the shallow quarry option. And we also looked at potable reuse. And when I say potable reuse, that's the use of highly treated wastewater for drinking water purposes. And I mentioned earlier, reclaimed water. The reclaimed water is use of wastewater, highly treated wastewater for non-drinking water purposes, such as irrigation and cooling buildings. So this would be for drinking water purposes. And those options were either really high cost or they're not currently legal in North Carolina. So that left us with Jordan Lake options. We feel like they meet our long-term needs and diversify our water supply, so they address that vulnerability of that small watershed with Cane Creek. They were lower capital cost of the other capital projects that we looked at, but there are several ways that we can use to access Jordan Lake. So the board has authorized us to further evaluate those Jordan Lake options. So where do we go from here? We will be reporting to our board of directors on what we hear through the community engagement process at their March meeting. We will then be developing guiding principles on how we further evaluate those Jordan Lake alternatives, and we'll be doing that late spring or early summer. And then we will evaluate those Jordan Lake alternatives in the next fiscal year. And then we'll go through that analysis and pick our preferred alternative and draft the long-range water supply plan, and we'll come back out to the community and present that and hear comments before the board adopts a final long-range water supply plan. So with that, I do want to open it up to any questions and feedback that you all have from me this evening and for Todd. I do want to say that if you're like me, you might think about something tomorrow or next week or next month. So feel free to contact me later. And that goes for the community as well, that they are welcome to contact me at any time. And I'm happy to speak with them and provide that information back to our board. So thank you.
Thank you. And if you're willing to give us the full screen back again, that would.
Yeah.
I see Mr. Boyncey's hand up and then Ms. Ryan.
Thank you for the presentation. I just had one question here, and I'll probably think of others as we go along in time, as you said. So my question is about the mutual aid agreements. So I understand that the mutual aid agreements, they don't define the circumstances in which Awasa can access water from the Jordan Lake allocation. But I'm wondering, maybe in the more recent past, or let's say in the past decade, under what circumstances has Awasa accessed the Jordan Lake allocation?
To my knowledge, we probably have not accessed it actually. That we have gotten water from the city of Durham, when you think back through the water, when we had that water main break out in front of our water plant, and then when we had the fluoride overfeed as well. That water came from the city of Durham. They currently get their water from sources in the Neuse River Basin. They also have an allocation of water from Jordan Lake. So the only time we've actually gotten water is not on an emergency basis, but when we've tested our interconnections with Cary and through Durham. So we would get our Jordan Lake allocation from the town of Cary. Apex have the only intake on the lake at this point in time, and get treated water from them. So we do want to test those interconnections so that if we had to access it, we know how to do it and that we could do it. So that's the only time, and Todd, correct me if I'm wrong on that.
No, you're correct.
Thank you.
You're welcome.
Ms. Ryan?
So you had stated that we don't have a guarantee to that Jordan water supply. So if everybody's in a drought and the other municipalities need it, they could choose not to deliver it to us. If we developed that partnership with a Western intake, would that change that situation?
Yeah, so there's two ways that we could, with the Western intake partners, we want to evaluate in more detail. One is that we could be a full partner, and that alternative was evaluated pretty thoroughly in we've provided to our board of directors. The second way is that we could develop a new type of agreement, and Dr. Greg Trockless over at UNC has been working with Awasa, Durham, Cary, and Raleigh, looking at ways we can proactively move water around the area. And one of the ways that you could do that is to come up with agreements. So taking advantage of the large amount of storage that we have in King Creek Reservoir for that smaller watershed, that Awasa is in a perfect position to take at off-peak times. So we could take when other people didn't need the capacity in their treatment plants proactively if we think there's a drought approaching, and then maybe not take that water when other people need it and then take it again. So we could either kind of guarantee our ability on an annual basis with those Western intake partners. The other thing that we could do is use our mutual aid agreements during off-peak times as well, when others in the region don't need the water.
And are there other mechanisms for doing that, or really that Western plant would be crucial to getting that?
If you wanted to guarantee the capacity, right now the Western intake, which does not yet exist, would be the way to go. Town of Cary, again, we approached them about it. They were not interested in doing that. They felt like because of the relationships that have been formed through things like the Jordan Lake Partnership, which is now the Triangle Water Supply Partnership, that they wanted to be able to provide water to whoever needed it most, rather than who has a kind of a contract with them to be guaranteed that water.
Yeah, I just worry about different jurisdictions trying to make the case for who needs it most, and who, presumably if there was a drought situation, we'd all be pretty much in the same boat. But okay, thank you very much.
Any other clarifying questions? Is there anyone from the public wanting to speak on this item? Michael, you're muted.
We have neither anyone signed up nor anyone with hands raised.
Okay. Bring it back to council for comments. Well, I'll share a few. One, thank you for coming to share with us. This is an ever increasingly important issue as the region is growing in leaps and bounds. The water collaboratives have been so much more helpful as we're working together on both water quality and quantity. North Carolina has some very interesting water quantity issues that actually fold into quality issues because we don't have any naturally made deep lakes or big rivers. We have creeks basically, and no aquifers. The growth in the area has spurred Raleigh to look at other ways of obtaining water. Cary and Apex are growing, as you know, quite well. And then Chatham Park will be coming online south of us, taking from the Jordan Lake. The allocation that goes to the Chatham County area is significant, and we're not quite sure how that all, we think we know how it's going to work, but we're not guaranteed that's how it's going to work. So these water collaboratives are very, very important and working together. The 2006 drought took a long time to recover from because it drained the groundwater and other resources, but we learned a lot. And then the breaks in the water system here in Awasa, we've learned a great deal from that as well. And it's forged these better partnerships. We have a line up to Hillsborough, which pulls from the Eno. We have the line to Durham. We've got these lines established that were never really working before. We hadn't tried them out, and we've actually been good neighbors and given water back to Durham when they needed it. So I commend Awasa for being willing to be collaborative and work with the other groups as well. We are probably the smallest entity of the bunch, but maybe Hillsborough, I'm not sure, but we're all working together for the same goal. And I think that's how you'll solve any future problems that come online. So it's great. And if you've never been to see, I don't know if you still offer tours, probably not during COVID. You ever been to a tour of the water treatment facility off Mason Farm Road? It's quite interesting. You can learn a lot about sludge. You can learn a lot about how we treat water and release it. It's well worth the tour and experience. It's very educational. I know they get tired of seeing me because I get involved in all the water issues. So thank you again for coming to speak with us this evening. And if council members have more questions, please feel free to reach out to Todd or Ruth, and also to our own representatives on the Awasa board. So,
all right. Well, thank you all for your time this evening. I appreciate it.
Thank you.
Yes, thank you very much.
Okay. That brings us to our next item, which is a concept plan review for 150 East Rosemary redevelopment. And welcome Corey Lyles and lots of folks here tonight. Michael Stevenson, Corey Lyles is also bringing in Joe Dye and Whitney St. Clair. So we've got a bunch of folks here to help us out. Thank you.
Good evening. Hope everyone's seeing. Started my presentation. My name is Corey Lyles with the Planning Department. I have a staff introduction for this concept plan, 12 slides, which will take about 10 minutes. And then we have members of the Grubb Properties team to give an applicant presentation after that. So a reminder that with a concept plan application, we're looking at a rough initial sketch from the applicant, where staff has not conducted a formal review. Some boards have provided some preliminary feedback, and then council may offer feedback as well, but no decision is required. And the concept plan is the initial step of a process where the applicant will move forward with the formal submittal in one of the 3 options listed here for a development application. The applicant for this concept plan has previously shared interest in pursuing the conditional zoning process, and there's opportunity for council members to discuss the process with the applicant. Our recommendation for you is to adopt a resolution transmitting your comments to the applicant regarding this proposed development. So here's the site that we're looking at, bound in red. It is the site of the Wallace Deck on East Rosemary Street. The Wallace Deck has 309 spaces. It's an existing parking deck, which would be demolished if this property were to be developed. The zoning of the site is Town Center 2. The proposal in this concept plan is to construct a 250,000 square foot building with office and lab space, and it would be between 6 and 8 stories. The building would include some structured parking at or below street grade. And in addition, this project scope would have a town green located at the corner of East Rosemary Street and Henderson Street. Here's a view of the existing conditions for this site. Rosemary Street running along the north, Henderson along the east. Site boundaries shown in green. And the existing parking deck is there. That's the Wallace Deck shown in orange. In addition, just some features of the site, there's an alley that runs behind the deck and has 2 entry points on Rosemary Street. On the east end, this alley connects to a small surface parking lot, which is behind the post office. All of this is one parcel, both the surface lot and the Wallace Deck, and the town owns all of this parcel bound in green. Here is a view of the applicant's concept plan. Once again, there's that boundary in green and the streets on the north and east. In the applicant's presentation, they'll have some additional images of their proposal, including some renderings, which get into the vertical design of this building. So we're testing out on the staff side, doing some initial evaluation of concept plans when they come to boards and council, specifically how the sites that are the subject of concept plans relate to the town's adopted long-range plans. So I'm going to go through a few things here, starting with the future land use map. This is our first concept plan after adoption of the flume in December of 2020. So we can look to the future land use map to see what it says about this site, which is here with the star. So we're in the downtown focus area, sub area E. And that gives us some guidance about a few things, including primary uses for the site. There's a range of uses considered appropriate on the future land use map. Commercial office is one of them, as well as multifamily residential, parks and green space, mixed use. But their proposal is within the realm of what's considered appropriate. The height guidance provided on the future land use map for sub-area E is that there should typically be heights of 4 stories at the street frontage, which could step up to 8 stories at the core of the site further from the street. The flume also shows East Rosemary Street as an activated street frontage, meaning that the buildings should engage with the street and there should not be parking located in between. Next, looking at our mobility and connectivity plan. Again, here's the site of the Wallace Deck with the star. Staff has noted that this site is within a quarter mile of a future bus rapid transit station, which would be on Columbia Street. The mobility plan shows bike lanes on East Rosemary Street. That's the dotted blue, are proposed bike lanes, which would continue bike lanes existing today on West Rosemary Street. And there are existing sidewalks along both East Rosemary Street and Henderson Street for the pedestrian use. A few other long-range plans we have, which are adopted components of the comprehensive plan. There's the Greenways Master Plan, which does not show any facilities impacting the site. There's the Parks Comprehensive Plan, which does not show any new parks in the vicinity of this site proposed. There's the Cultural Arts Plan, which identifies a variety of downtown locations that could be suitable for public art. The Wallace Deck is one of those locations. And so we would advise the applicant as they move forward to consult with our cultural arts staff to see what might be appropriate for this site. The other component of review we've had is by our advisory boards. This concept plan went to both the Historic District Commission in December and the Community Design Commission in January. You'll see on this map, the green line here is the boundary of the Franklin Rosemary Historic District. So that does actually cut through the site. The existing surface parking lot and future town green is located inside the historic district, and the proposed building would be just outside the historic district. So we did have both of these commissions review and gave them opportunity to provide comments on any aspect of the proposal. Their comments are in your agenda packet, pages 113 through 119. A few highlights, and this isn't meant to represent every point, but especially those that were shared by both commissions or by many members of one commission. The commission members expressed a general preference for this building to be 6 to 7 stories instead of 8 stories, as the applicant shared with them some options for the size of the building. They also encouraged design elements that could break up the massing of the building, such as materials, and that could apply both to the horizontal experience along the street and vertical given the height. They suggested that the building design should fit in with the historic context of surrounding buildings in downtown and in the historic district, including the post office. They encouraged including pedestrian-friendly ground floor elements. That could include a strong building entry experience. Also, the idea of using the rear alley as a pedestrian link to further develop the pedestrian network. And finally, with regards to the town green located at Rosemary and Henderson, there are some mixed opinions. The existing parking lot is above the level of the street. And so there's the option to either grade it to bring it down to street level, which some commission members preferred. Doing so would remove the existing magnolia tree, and so some expressed a preference for preserving that tree. And that's the information I have to share with you. Again, here is the recommendation to adopt a resolution transmitting comments. At this point, I can take any clarifying questions, and then the applicant has their presentation as well.
Why don't we let the applicant do his presentation and then just say combined questions for both later. Thank you.
So good evening, everyone, and Happy New Year, if it's not too late to say that. It's a new year and same old, hopefully friendly, familiar faces. I know you all are aware that this is part of, Joe Dye with Grove Properties. With me tonight are Whitney St. Charles, an associate on the Grove Properties team, and Michael Stevenson with Perkins Eastman, who, as you well know, is our architect design, leading our architect design team for 150 East Rosemary. Corey stole my thunder with his great presentation. He covered all the great points. We felt like we had a really good interactive dialogue with the Historic District Commission and the Community Design Commission before tonight. And he reflected a lot of those comments very well. And without further ado, I'll turn it over to Michael for the presentation. We're pleased to be with you tonight. Thank you.
Thank you. Okay, you see my screen?
Yes.
Good evening. Nice to be back with you all. I'll just hit the high notes. Corey made a good overview of the site. You know it well. The historic district boundary, just some of the character of the historic district, walking around, particularly paying attention to landscape elements and walls and colors and so forth. A little bit about topography. Rosemary Street is relatively flat from a low point at 465 at the corner, 466 up at the alley entrance, but it goes uphill as you get to the alley. The high point is actually right at the back of the post office building. I point that out because there's a bit of a topography challenge for walking from Post Office Alley to get back down to Henderson's, the corner of Henderson and Rosemary. That gets to the element of regrading the open space to make it more walkable. And then specifically there, you all know that most of that green space is surrounded by a concrete retaining wall along the two edges of the streets. That is pretty much containing the root ball of the magnolia. And I've actually walked this now with a landscape architect. Pretty conclusive that if we regrade this, my opinion is all things, looking at a big picture, it's better to create a successful urban space and rather than try to keep the one tree, because it's very likely that any kind of grading in this area would lead to the tree's demise. But that's something to think about. And then also on the right, a photo looking up to Post Office Alley from Rosemary. We'd very much like to open up that view, hold the building edge back, and create a visual as well as a walkable connection extending all the way from Franklin to Rosemary, much like was done over on Varsity Alley, or will be done. And then of course, we all know this is part of a bigger development strategy, redevelopment strategy, and improving streetscape along a great deal of the frontage of East Rosemary. And this will very much be a part of that, including the sidewalks on Rosemary and Henderson and the town green itself and the extension of the alley. So the public realm is just as important as the building in our mind for this project. You've seen the site plan and how it functions. We're still looking at exactly how the parking will be laid out and accessed. We're trying to put most of that parking access from the alley and minimize curb cuts from Rosemary. I can't say we will be able to eliminate them entirely, but our goal is to have as few as would be needed. So we have started, I want to point out we're very early in the design process. We're looking at very general aspects of height, massing, and footprint. So we went around and took some pictures, and then we modeled the context and the building massing, and then we photoshopped those in to start to look at those from different vantage points. So this would be a 6-story structure as seen from standing opposite post office building on Franklin Street. 7 stories would look like this, and then 8 stories would be roughly this. Also, just I want to point out one of the intentions here architecturally is that this building being a research building, we very much see it being having an affinity with the campus, and we'd like to make really emphasize the transparency of that so one can understand the nature of what's going on inside the building and see that relationship to the university. Now, from the opposite end of Franklin Street, looking back east, and there, the yellow brick, of course, that is the elevator core of the old NCNB building, which will be renovated. So 6 stories, you can barely see it right there, that little white piece. Then 7, you start to see it coming above the rooftops a bit. And then 8, coming a bit higher still. Then on Rosemary Street, so now you'd be standing in front of what will be the new parking deck, of course, looking east. So this would be 6 stories. And in keeping with the zoning, we'd be going up 4 and then stepping back and stepping back again. So 6 stories, you would look like this. 7 would look the same because the 7-story piece is stepped back further. So at 8, you would start to see a little bit popping up above that mass there. Then finally, from the corner, looking back toward the west, across the town green, that would be a 6-story building. So it's 4 stepping back to a 6-story mass. Then the 7-story version would be taking the southernmost mass and taking it up an additional story. And then 8 would be taking that same element up 1 more floor. Just a bit about our thinking about the character, and you know, we've shown you many things on previous projects, but we do believe it's possible to have modern architecture in a historic context when done sensitively, and the use of materials and detailing and the articulation and proportions. These are just some examples of those. And more examples. The center one you probably know is this new student union at Duke University. We think that's a great example of the approach we're thinking about of using, you know, frankly, modern expression and materials, but done in a way that's very sensitive to historic architecture in the immediate context. Materials we're thinking about, terracotta and brick. You know, of course, terracotta will be used on the cladding of the new parking deck. We could also look at different brick colors, and of course, there'll be curtain wall glass. Fortunately, the building is oriented with its long axis in the east-west orientation, which provides great opportunities for natural light on the north and south facades, minimal exposure on the west and east, which are much harder to control solar gain. So that works in our advantage for natural daylighting and reducing energy use. And then where appropriate, use of natural materials such as wood to bring in warmth and that texture. So we just started, again, cautioning these are very early, you know, just thinking about taking that, and we picked just 7 floors to do these quick studies. I will also mention that did, I would say from a number of members of both advisory boards, 7 did kind of seem to be a sweet spot in the views of many. We tend to agree with that. So these are showing a 7-story version. This would be somewhat of a more traditional approach with maybe masonry and punched windows, stepping back according to the zoning. Another approach could be to juxtapose a more solid central element clad in maybe terracotta or other solid material, and with a glass, more of a glass element facing Rosemary Street. That could also be reversed with an idea of taking the more solid material and the lower element, articulating that into vertical bays along Rosemary Street, and then a higher mass, possibly out of metal and glass that's a little lighter and a little more reflective. The fourth one is an idea of keeping the scale along Rosemary and the town green lower at 3 stories and wrapping it around at that height, and then going up to 6 and 7 in the central and southern masses. And the final study was thinking about making a bolder gesture facing the town green, more like a window to the green, where you start to sense the relationship of outside to inside, and really making that a big thematic idea for how you address the green. So these were studies we shared, and we got some good feedback on some of the options for us to think about. Just again, in summary, I think there was a general consensus at 7 felt pretty good. And that the comments that were made by Corey about our articulation, also marking an entrance on Rosemary Street more clearly, maybe with a vertical break. Those are good comments that we'll be thinking about and incorporating into our thinking as we go forward. So with that, I'll just open it to any comments or questions.
Okay, thank you.
Thank you.
Can you bring us back to full screen, and then we may ask you to put some pictures back up in a minute. But,
absolutely. Okay.
Mr. Parker?
Yeah, a few questions. Particularly, I'm curious about parking. If you have a rough idea of how many spaces are anticipated to be in that building. I may have remembered incorrectly, but I thought, in the very early conversations, it was the parking below grade that might be retained. And you're now talking, I believe, about parking on the first floor as well. So if you could talk about, number one, is that A, am I correct? B, how much parking will there be in toto? We certainly don't want to get into competition with the new deck that we're building. And then 3, how all that parking, would there need to be any parking access from Rosemary Street, or can all parking access be accommodated by the alley?
Okay, I'll try to be really succinct because it's a complicated question, but basically one easy answer is we think we're going to get up between 150 and 170 cars on the site. Second part is that we want to use the existing excavation that's already present in the Wallace deck for the building. In other words, the hole's already been dug, so we want to take advantage of it. Now that parking deck is a split level deck, as you may know. The 2 bays are offset by half a level, one from one to another, with little short ramps connecting them. So it does complicate a bit how we lay out our parking deck and how we access it. There would be no above grade parking on Rosemary Street. We will take advantage of the lowest level there that we can extend all the way from the alley to the Rosemary Street edge, but that's below grade. So there's no intention to have any exposed parking facing Rosemary Street or the town green. On the alley side, however, there would be a level and a half exposed above the alley to the south. So that's, generally speaking, the number of cars and how they'd be arranged. The access, because of the staggered or split level layout, it's easier to show than to explain, but we don't have those drawings to show. But essentially, it means we have to provide multiple points of access rather than creating an internal ramp like you do in a conventional deck. So we think 2 of those can be off of the alley. There will probably have to be a 3rd one somewhere on Rosemary Street, although we're looking to see if we can get that over off of the alley too. Keep in mind, right now there are 4 curb cuts on Rosemary Street. On that stretch, you have 1 for the alley, 1 for a garage entrance, 1 for a garage exit, and 1 for the alley exit. So we will certainly be reducing that number from 4 down to certainly 3 or possibly 2. So we'll definitely be improving the situation. At this point in our design, I can't say for sure we have no parking access off of Rosemary.
And just curious, and I don't know if you or anybody who's currently on the meeting can answer this question, but I know there's been a lot of sort of questions and concerns about the magnolia tree. What is the life, how much longer do we expect it to live? I mean, the building will be there a very long time, and, it would be a shame to really mess up the design of the public square if the magnolia tree only has, 5 or 10 more years to live anyway.
That I don't know, and probably we could get an arborist to weigh in on it. I'll just say, and I'm working on Freedom Park in downtown Raleigh, and there were some beautiful oaks there. we did a lot of detailed study, and the problem is with a mature tree that's already well established, any kind of disturbance in the root zone can be very detrimental. It may not just die right away, but it may accelerate its decline, and it would start to, go into a phase of poor health. So my concern is that we might try to keep it and do some landscaping, but still the thing would start, a decline, and then nobody would be happy. So I think it probably merits a little more study, but the initial view right now is if we try to do any regrading or even significant paving around it, it's very likely to damage the tree.
And the last question, and I probably should know the answer to this, so I apologize, but the post office has need for parking trucks and stuff like that. Will the creation of the town green impair that, or how will the post office deal with its vehicular needs?
Well, Joe, I'm going to punt a little bit here. I mean, I think it's an area we haven't talked a lot about yet. There's clearly a desire to make a nice public space here, but I think there's going to have to be some discussions with the town and how it plays out.
It's something we are thinking about, Mr. Parker. I think, there's obviously a loading dock area facility back there and a certain number of spaces. So we have talked with the town there's an existing lease, I believe, for some number of spaces on the town property. And we're trying to work through what is that commitment, and might it have to go in some of the parking with the new building, or how that would be arranged. And we're working with Michael's team to study that. Our goal is to make the best town green possible, and then how do we accommodate the needs of the post office as that existing use.
Okay, well, thank you.
Mr. Boynton, followed by Ms. Gu.
Yep, so I've got two questions. The first one is wondering if you could tell us a bit more about the town green. I guess I'm thinking more about what you're envisioning in terms of amenities, such as benches or other things on there. Can you tell us more about your thinking there?
Sure. I think overall we'd like to make it a welcoming space, a place that feels accessible and active. So first of all, that, to my mind, that means breaking down barriers and bringing people in from the street. Right now, it's impossible because of the walls. That's number one. But number two, I think that providing those places to sit and have activities is very much our desire. And we haven't gotten into the design of it or the programming of it and yet, but things such as you might have steps coming up from the sidewalk that might transform into like stadium seating where people could sit there and watch people walking by, or maybe you sit there and playing your guitar or something. But those kind of things that just encourage that normal everyday kind of civic interaction is kind of space we'd like to see there. So, but the design of it, we just really haven't gotten into much.
Michael, it may be helpful for this part, if you don't mind putting up that site plan, because I think it's helpful for folks to see how you come out of Post Office Alley down to that corner.
Sure.
Because that's part of that experience. And just to remind everyone why he's pulling that up, I believe it's a part of the economic development agreement. It's a commitment as part of this development, but that'll become a town green. So I would envision that being something we work with staff. I know Brian Peterson was very helpful on some of the deck elements, for example. So we'd want to engage with staff on some of the elements that Michael spoke to, Alan, that you're asking about, to make sure we incorporate those ideas in the town green.
Yeah. So again, Councilors, very early, very conceptual, but at a high level, we'd love to see where the alley extends back down to Rosemary, that be designed more of like a plaza where cars are allowed to drive across it, but it's understood and feels more like a pedestrian space. We'd love to see Post Office Alley extended back down to Rosemary, but also create a path over to the corner, because many people will be crossing, from the crosswalks there at the corner of Henderson and Rosemary. And then the idea I was talking about, maybe there'd be places to sit right here. Obviously, the street corner is a place people love to hang out, and if we could provide that opportunity there, we think it'd be a very much used place. So, and then there are currently 5 crepe myrtles here that could be kept. There's opportunities for other tree planting and green space landscaping. And there's some grading challenges we'd have to design for. As I mentioned, you go about 10 feet down from here down to here. But there's great opportunity here to make a really great space. And I think many people have commented that there really aren't many public green spaces in downtown. I mean, obviously, Oracle Place, the best university. So this is something I think would be a great amenity and very much welcome in this part of town.
Got it. Thank you. And my second question is, I know that you said throughout the presentation that it's early in the design stage, but wondering about the extent to which Brian Peterson has been working with you all to date when it comes to the design and architecture of the site, of the building.
Brian and I have had a couple of conversations, but we're just really starting here, and so I would say to date, really not much, but we will be beginning that dialogue here in very short order.
Thank you.
Mm-hmm.
Okay. Ms. Gu, and then Ms. Ryan, did you have your hand up? I'm sorry, I'm losing people with Ms. Gu. And just a reminder that this is clarifying questions right now. We'll come back for comments, and I'll be asking all of you to give your preference on a height. So if you need to ask questions related to the height, I would suggest you get those questions in now. Thank you.
Yeah. So my first question is regarding to the parking spaces. When we are at our initial discussions regarding this whole project, the parking decks and this office building, and the number at the time we were given is there are expected parking spaces for this office building is 200. So the number that you just gave is 265, 276, then that will represent more than almost 35, like 32 to 38% of increase in parking spaces in that office building alone. Of course, Councilor Parker just mentioned about the potential competition with our parking deck that the town is building. I think another concern, of course, is we really do, for this, the Rosemary Street, that section, we really wanted it to be a viable, with vitality, with people like looking for, like visiting that green spaces, like biking along that area or walking in that area. I'm concerned that with that number of significant number of parking spaces that are concentrated in that section, I don't know that, do you have any, well, first of all, my question is, first of all, can you explain or help us to understand what's the rationale or what's the reason that to increase the parking spaces more than 35% in that office building? And second, do you have a rendition of what the first floor, the ground floor is going to look like? Because I think the pedestrian, we always talk about the pedestrian experience is really affecting how this area is going to be perceived and whether or not people are willing to come to that area. So do you have any rendition what the ground floor will look like, or whether the pedestrian or bicyclers experience is going to be?
First of all, I think there might have been a misunderstanding. What I said is there would be 150 to 175 cars. So it's actually less than 200.
So so it's a 156.
150 to 175.
Okay, so
designs are final.
are these okay? That's great to know. So are these spaces going to be all underground, or going to be the first floor or ground floor? How is that?
So there will be one full level below grade. Then there will be 2 levels facing the alley. That would be a story and a half above grade, but facing the alley. Nothing above grade facing Rosemary Street or the town green.
Okay, so the street level experience along the Rosemary Street, they are all going to be like office spaces?
Yes, it would be, we would treat that with the building entrance, lobby, other program spaces with mostly glass. So as you walk by, you see the activity. And at night it'd be well lit, and we'll be widening the sidewalks, providing new street tree planting and paving. So it'll be much improved over the current condition.
Okay, so is that a side that are facing the current town green? That east side, what is the rendition going to be for that side?
Well, okay, it's still very conceptual, but we'll be wrapping around that same treatment with transparency and openness, wrapping similar treatment on Rosemary Street around facing the town green. So all the service elements and parking access and those types of things will be from the alley. So none of that would be visible from Rosemary or the town green.
Okay, so the parking spaces of that building will not be visible. I mean, from a pedestrian perspective, it's not going to be visible at that ground level.
Not from Rosemary Street or the town green.
Okay, thanks.
Okay. Anyone else have questions? I can't see everybody, so I'm sorry. I've got most
of it. Should I give back the screen?
Actually, I'll ask some questions now in case someone fuzzes at me if they want to ask some. A couple of points. I'm going to be advocating for widening the sidewalk on Henderson Street by getting rid of the parking on the west side of Henderson from Rosemary to Franklin. That sidewalk experience is dreadful. We have a lot of people walking that way. Would you be open to that concept there, or is there anything that would prohibit you from being open, especially if the town green is going to be flattened out? It would make that experience there so much better for everyone to see it and be attracted to it. Is that something you're willing to consider, or is there anything that would impede that?
Well, if we regraded it, we certainly could widen the sidewalk into the town green space, if that's what you mean.
Well, no, I'm talking about getting rid of a whole row of on-street parking there. So the sidewalk would be widened out somewhat. We could even end up putting a bike lane. I can sit down with Brian and sort of go over that, but I didn't know there'd be anything that would impede your design from having that aspect.
Oh, no, not at all. I mean, that's purely a matter of, that's in the right of way. That's just purely a matter of the town deciding what they'd like there, but we'd have no issue with that at all.
Okay. I had talked to Clay Grubb about needing more outdoor rooftop experiences, and we had talked about having something like that on this building that facing the campus side so it wouldn't project noise into the neighborhood. Is that still being considered? It didn't have to be a large space, but if we're doing a lot of research and having people have the ability to be out, research takes long hours. And we've talked about people being able to have different experiences, healthy experiences.
Yeah. I'm sorry, I keep pushing the wrong button here. Yes, and in fact, when I mentioned the idea of, this kind of big expression of,
right.
That is the idea of that is this would be a walkout kind of terrace for those occupants to be able to occupy that and look out, and then that'd be a great amenity for the building occupants, but also be great when you're looking up kind of to see that activity there. So
Right. Okay.
We really like that idea as well.
Good. And then was there any thought given to maybe some kind of retail, specifically food oriented, on the first floor off the entrance on Rosemary, coffee shop, bakery shop, something? We're going to have a lot of workers in that building. It would also draw people into the building. But is there any thought given to that? You've talked about activating that first floor visually, but was there any thought given to activating it so there could be actually something that draws people in who aren't working in the building, or draws people who are working down to the first floor?
Well, I won't speak for Joe. The first floor is going to be designed with a higher floor height and with a lot of glass facing the street. It would certainly be physically possible to accommodate that. I won't speak from the business perspective as to having retail in there or not. I really don't know.
I think the way to answer that, Mayor Heminger, is we're not opposed to it, and we need to set the building elevation and height. A lot of the feedback we're looking forward to getting from you all tonight, where we can study that opportunity, and we do want to be sensitive to, the retail environment and what's there existing, that we want to be in balance with that and not necessarily competing with that in a negative way. And that's not to say we don't want to do it. We just need to study it more. And we think that, if there is that opportunity, certainly it would be at the ground level.
Okay. Thank you. All right, council members, any more clarifying questions before we ask to hear from the public? Okay. Is there anyone from the public wishing to speak on this item?
There is not.
Okay.
Double check that. No.
All right, we'll come back to full screen if we can. I know you're expecting to hear some comments from us. I'll ask each council member as they make their comments to say of your preference, if you're willing to say, 6, 7, or 8 stories, just where you're leaning. You've read and seen some of the comments from our other boards and community members. And so I yield if you'll just make your comments. We're not voting, we're just yielding comments. So that gives the applicant some information to go for. Any other comments? I think we already heard the one about having an entryway, a more visible entryway on Rosemary Street for pedestrian access to the building. I don't know if you want to weigh in on regrading the town green. Do you want to weigh on that today, or do you want to wait and see? Or why don't you give your preference, or say, I'm still thinking? How about that on whether you want to regrade the town green to be flatter, more accessible, or terraced, or whatever it is, or whatever. So we'll do that. All right. Comments, Ms. Ryan.
Thanks for your presentation and the drawings. I'm very intrigued to see where you're going to go with that building. I think some of them are very exciting, especially the ones you were describing as Boulder. I think could be really exciting there. So kudos on that. In terms of the building height, I'm going to disagree with your characterization that the CDC and the HDC settled on 7 as a sweet spot. I see a lot of variation. The meeting that I sat in on too with the HDC, I think there was pretty unanimous agreement that 8 felt too high for most people. The other comments that were in our packet were settling around 6 or 7. So I think that both of those are still on the table. And I don't know if you've been down to the 400 block of West Franklin, but several years ago, a residential student apartment building called Shortbread Lofts was built on Rosemary Street. And it, to my mind, has really had a negative impact on the 400 block of West Franklin, the way that it looms over these sort of very old Chapel Hill character small retail buildings. So, and you're kind of in the same boat with some of the buildings you've got on Franklin Street here. So if you do decide to go up to 7, what I'd really like to do is to see what that would look like if you are standing across the street on the south side of Franklin, or maybe even into some of those lawn areas there, just to see if we're going to get that Shortbread Lofts effect or not. So I think from the Rosemary side, the way that you have the massing, the height doesn't concern me there. It's from what we're going to be seeing over on Franklin Street that I have the concerns. So right now 6 is feeling right for me, but but I would be happy to look at other renderings and see what it looked like from on the street there. Again, I think I'm fine with modern architecture. I know some folks have gone back and forth. I think some of the things you're proposing are exciting. So I look forward to seeing those. One of the things with the parking deck that was unfortunate just because of some geometry issues was we have a pretty stingy sidewalk in parts of it. So whatever we can do to be generous with the sidewalks in front of the building. It not only makes better pedestrian space, it's going to let us have more street trees. We're going to be fairly constrained in what kind of shade we're going to get on that north side of the street. So anything you can do there would be great. And for the town green design, I would love to save all the trees. I think it would be worth turning your landscape architect loose to see what they can do, but I'm going to accept that that may not be possible for that magnolia. And I realize that your designs now are very, very schematic, but I think there's a lot of good placemaking stuff we can do there. I walked around the area with Brian Peterson one day, and we were talking about Paley Park in New York and, you know, all kinds of really great small places that we could have. So I'd really love that if this isn't just a place to pass through, but there's something, a coffee kiosk, or there's something, or as the mayor was talking about, if there was a space in the lobby that was facing out to the green, you know, where folks walking through could grab a cup of coffee or whatever. So, and I had a great grandfather who used to run a cigar stand in the lobby of a big office building in Cleveland. So it can, all kinds of little businesses can fit in very small spaces in office buildings. So, but thank you. I'm excited to see where the design goes.
Thank you.
Mr. Anderson, then Mr. Parker.
Yeah, thank you for this presentation. I am leaning towards leveling and yeah, I would love to save all the trees also, but I think it's really important that the placemaking there be good. So I would rather have that be level. But if there's a way to save the tree, that would be wonderful. But I do think it's really important for that placemaking to be right. I like the idea of modernist with the historical context. I think that can work really nicely. I would love to see if we could reduce the curb cuts as much as possible, just safety, pedestrian experience. I think that will benefit. Please just keep Brian in the loop and working with you. I think the placemaking is just so important down here that that will be, you know, a huge asset to the project to continue to have him deal with the placemaking. Again, I think we just really want to focus on that pedestrian experience and that sense of place and making it a really, really cool place. For me, the height, I guess I'm having a little bit of a hard time answering that question, just not knowing all the programmatic needs or what we'd be missing without a story. So that feels a tiny bit hard. I mean, if we're going on aesthetics only or what I think fits in the area, then I'd be at 6, and maybe you could go to 7 if it was spectacular. Which I think someone on the CDC said you could go to 8 if it was spectacular. I would go to 7 if it was spectacular, but I would definitely lean towards 6, given our future land use map is going up to 8, but we're not in the future yet. But again, it feels a little tricky, given that there's more than just that to consider when we're talking about the height. So I would like to understand more about what we would be giving up there. And I think that's it. Sorry, I'm a little sleepy, but that's it.
Mr. Parker, then Mr. Nguyen.
Yeah, I think it's coming along nicely. I can see the potential there. There's just lots of good things that can and I hope will happen there. I think 8 just, when I looked at, not just because 8 is a funny number, but when I looked at the, your renderings, it really did seem, just with what you showed us, to loom over Franklin Street. So I think I'd struggle to go with 8. After that, 6 or 7, I think, I'm not somebody who believes in strict numbers of heights. And I think, good design can make tall look very comfortable, and bad design can make short look awful. So I think a lot's going to really depend on how you design the building rather than just whether it's 6 or 7 stories. So do good.
I'm going to write that down, by the way. That's a good quote.
Do good.
No, that good design can make tall look good and or short look awful.
So, and again, it was tough to tell by your renderings, but I think, it also occurred to me that the east wall of the building, which will face the town green, I think that's going to need a lot of attention, because I don't know whether it'll be glass or some mix, but you really want to make sure that it harmonizes with the town green, and you just don't have this sense of a green backed up against the blank wall. So I don't know whether that'll be glass, how you'll do that, but I think you want to give some extra attention to that east wall. I think in terms of the town green, this probably makes your life miserable, but I think on the one hand, I'd like a reasonably flat space where you could have coffee cart or a kiosk or something like that where people will feel comfortable. But I think you referenced it. I think this notion of some kind of a terraced, mini amphitheater that could be used for street performers. If you've been to Asheville, and they have the drum circle in Asheville, where they've got, just 2 or 3 levels of space. People come there on Friday nights, listen. So I think if we can create a space like that, I think that could be really wonderful. And so that it's not just passive, but we can also activate it and make it an active space. I think in terms of the first floor, again, what would be, we talked about activation, and, maybe it's a stretch to have retail. I know we always talk about it, we never seem to get it. But if, Joe is willing to invest a little bit in terms of using the space, creating some kind of an art gallery or an art space on the first floor. So again, it would be something visually people walking on the street would want to stop and look at. There, you could have rotating art displays. We have so many wonderful artists in our community, and a real paucity of places for them to exhibit. So I think that could be a really interesting use for some of the space on the first floor. Again, I understand economics will rear its ugly head, but that's at least something I think could really make the street, in combination with the town green, very special. And then I'll echo, I think, what Ms. Anderson said. Anything you can do to reduce the curb cuts on Rosemary Street, I think is going to be really important. We want to activate the street, and if the building frontage, and we're talking about how we activate the street, and if there's a driveway going through, that's really going to break things up in a not very pleasant way. So anything you can do there, I think I would really, really appreciate. But I think, as I said, I think this has the potential to be really terrific. So I'm really excited. Thank you.
Thank you.
Great. Mr. Nguyen, followed by Ms. Stegman, then Mr. Boynton.
Yeah, I'll be brief. I'm leaning towards being in favor of the grading. I definitely, given our investment in this project, definitely want to emphasize the placemaking, and also given how large our investment is in infrastructure to enable this, I definitely want to get the most office we can out of it. So I'd be, okay with 7, given a good design, which I'm confident in Michael's skills. I know you didn't ask, but C and D look pretty dank to me. Big fan of those designs. And I think that was also want to echo minimizing the curb cuts, and Mayor Hemminger's suggestion about expanding that sidewalk and getting rid of the on-street parking on Henderson. I know a lot of students walk that corridor to campus, and we would all greatly appreciate an expanded walkway there and better pedestrian experience.
Ms. Stegman, Mr. Boynton, then Ms. Gu.
And thank you for very useful presentation. I'll try and go through the list quickly in terms of height. I agree 8 felt kind of looming over Franklin Street a bit too much. 7 seemed not to be. It seemed to really be that turning point. So 7 is fine with me. Again, to Mr. Parker's comments about done well. But I want to maximize, this investment and as much office space as we can get. So it seems to make sense to me. I love the modern design, contemporary architecture. I echo Ms. Ryan's go bold. This really is a statement building, and it should be really creative and interesting. And I agree, if we can save that tree, that's wonderful, but that space is so important, the green space. So doing everything we can with that is critical. And just, bike and ped plans being really well thought through and a priority, I think is important. And the last thing around the public, the first floor activation, if an art museum, a gallery is possible, great. Maybe there's potential for collaboration with UNC Arts Everywhere, with local artists, to have some kind of rotating, the word I can't come up with, exhibits, thank you, and thematically connected to the science and the work going inside the building would be a nice connection. I do like that last, I think it was E design, that to Mr. Parker's Mr. Parker's comments about the green space and the glass and the interplay between the building and the green space. Anything else? I think that's it. Yeah, I'm good. Thanks.
Thank you. Mr. Boynton, then Ms. Gu.
Yep, thank you for the presentation. For the story height, I'm comfortable with 6 to 7 stories, but of course the design of the building will be an exceedingly important element of this, as my colleagues have said. I like the idea. I think Mr. Stevenson, there's something you said that really piqued my interest, where you said that the town green can be a place where natural connections can happen, and a town green that does that, I'm fully in support of. I appreciated Mr. Dye's point about being careful not to undercut businesses of existing shops and restaurants on Franklin Street, especially as we move into the decade and into post-pandemic. Want to be supportive and complementary of our existing Franklin Street businesses. So I appreciate you saying that, Mr. Dye, and hope you'll take that into account as you think about how to activate that first floor. For the town green and whether to regrade or terrace it, I'm for regrading it, or I'm leaning towards regrading it. I'm not sure, but perhaps at some point, as you're designing the town green, Parks and Rec Commission may be a good entity to weigh in. I know that I've heard some members on that commission, have talked about wanting to have more green space in downtown. So if you're up for it, I think they would certainly have some good feedback for you. Thanks.
Ms. Gu?
Well, I think I just try to be really brief because I think my colleagues have covered a lot of very good comments. So I think I want to emphasize that this is, our town has a significant investment in this area, and we really, really want this to work. So anything that you can do to improve, not only providing office spaces, of course, that is very much needed. If we can provide the improvement of green spaces or like really good places that for other people's of the town can enjoy, that will be something that's greatly appreciated. I think it's something that we really needed as well. And I think there are lots of discussions about the integrated multi-use of the space. So if this building is only designed for 9 to 5 office workers, I think it will not be very activated. If we can integrate many other uses, like considering different people can use this space at different times, I think that will be really, I'm hoping that that will really bring people around the town to that spaces and also draw customers to our downtown businesses. So if anything that we can consciously to even like adding bench or other things that can really help other people or drawing people to come to this area and integrate multiple different uses, improving the pedestrian experiences. I think that all the things that we're looking for. With regard to the height of the building, I think the drawings that you just presented so far, it was especially like from different angles to compare 6, 7, and story buildings, they're helpful. But on the other hand, I think I heard the feedback from people is because it really doesn't have the details of the design. So it just looked like a big concrete in the back of the church. So I think that I'm not sure that that really is an accurate rendition of what the experience for those taller buildings is going to be. So if we're for, I mean, it really depends on the financial and all the other considerations that we have. If we're going to propose higher or taller buildings, I'm hoping that we can give the people of the town a more detailed rendition of what the true or closer to the true experience is going to be. I think it's almost unfair that asking people to imagine those white blocks are actually something beautiful. So I think if you can do anything to help people to make that connection with what the true visual experience is going to be, I think that's going to be helpful. But on the general level, I agree with Councilor Michael Parker says. I do not think that we have to say it. Well, at least at this time, I'm not sure that I'm just saying that this is the level that I cannot go or I have to go to. I think it really depends on what kind of design that you're going to bring forward.
Okay. First, I'll just share a few of my comments, and then I'll see if I can wrap up what everyone says, that you have something that you can work from. I'm very, very excited about this office building. We need new office. I'm very glad that you're leaning towards research and development. Just see our community really, really growing that direction. I'm excited about the town space. I like actually the idea of the terracing effect, so that if you did regrade, you wouldn't end up with a 12-foot wall at the back of it. So there's a way to sort of terrace and have some natural seating, which would lend itself to some mixing of performances or just activity, something like that. I actually like the idea of, if you look at the studies, we're still under coffeed in our town, if you can imagine that, but maybe there's a way to have something out that faces the town green and the building that works together. And you've heard suggestions. I know you can't always, find tenants that actually reflect those, but just to be thinking about that as you design the space. There also should be an entrance to the building on that side as well. So people in the building can come out to the town green. So there should be a way to go to and from that as well. I like the modernistic approach when it includes lots of glass. I think that's really kind of shows the beauty in our community by reflections and taking in light and all those things that go along with glass. And I would agree. I felt like the 8 felt like it was looming because it was a big mass that you showed us. If it was glass, I'm not sure I'd feel the same way. So I'd like to see the design. But if I had to wrap up what the council saying, is they're comfortable if it's done well to go 7. They're not opposed to 8, but they just can't see from that looming picture what it would look like. So that's what you're hearing. I would, same thing, the curb cuts and really taking the view of the pedestrian in this experience along Rosemary and Henderson, and working with our urban designer, Brian Peterson, to talk about all those things and how they play together. Our post office site is very important, as it houses not only our post office, but our court system, but it also our Peace and Justice Plaza. We have people gathering there all the time. That was another reason I wanted the sidewalk to be widened, as people are trying to come to and from that space. It lends itself better. And I would agree with Mr. Nguyen, as I see students walking along, there's a lot of that sidewalk's narrow and there's a lot of impediments in that sidewalk, from telephone poles to everything else. So we'll work from our side to have discussions about removing the parking, but I just want to make sure there were no impediments from your side on that. And I had to laugh at that our attorney's giving us the definition of dank, Mr. Winson, from on in the chat box. So we've got that going on. I think that's what Ms. Ryan, did you have something else to share?
Yeah, just something real quick. I hear people want to see more about the height, but I'm not sure that I heard that people are all okay with 8 stories.
No, I didn't hear they were all okay. I heard they weren't scared of it if it didn't look like that massing. They wanted to see it before they made that decision. I heard that comment repeated. They were comfortable with 6 and 7.
Yeah, 6 and 7, I was hearing more support from and willing to look at 8. I think just to be clear.
Okay. Thank you for making that more clear. All right. Is that all? Is that enough from us? Or is there anything else you were looking for from us, or do you feel like that was?
No, it's great, because these are really the fundamental questions, we're looking at this stage, and this gives us a great foundation to move on to the next stages of design. So I really appreciate it.
Okay.
Very useful discussion.
All right. Well, thank you. We're excited about this project. As you can tell, it's going to add new life and vibrancy to downtown, and just create more local jobs, which is fabulous. With all the research and development going on in our community, and have a home for it in the town is great. Do we have to make a motion to refer transmit the comments?
Yeah, I move R7.
Second.
It's been moved by Mr. Parker, seconded by Mr. Nguyen. Any more comments that haven't been shared? Okay. Roll call vote. Mr. Parker.
Aye.
Ms. Anderson.
Aye.
Mr. Boyncy.
Aye.
Ms. Gu.
Aye.
Mr. Nguyen.
Aye.
Ms. Ryan.
Aye.
Ms. Stegman.
Aye.
Mayor says aye as well, so that's unanimous. I think that's all we have on our agenda for tonight. So you get off our, I know. Thank you all for being here. We have a closed session next week. We are hoping to get you the information as soon as possible. I don't know that we have anything else we need to share this evening. All right, we'll have a good and safe evening, and we will touch base soon. Thank you, everybody.
Good night.
Be safe.
Bye.
Celebrate.
Woo.